They are committed to serving their communities. They also see so many issues of obesity, diabetes killing our residents. They want to do the right thing for our residents too. And so that's why we want to work with our store owners to provide healthy choices, healthy alternatives, and options for our families. And so you'll be hearing, for example, from Antoine Dow, the owner of A&M Stotts Grocery, who will speak about what he sees in his neighborhood and why he's supporting this legislation. I'll also mention that if you, or for any of you who've been going to a store, who are in a store, and you're thirsty, and you see a warning label, your first thought is not going to be, well, I'm not thirsty anymore. You're going to be thinking, well, I should look for something else. Or maybe I'll choose that soda that one time. But at least I know about the consequences. At least I'm informed about the choice. Which brings me to another argument that some will bring up, which is that it is a matter of choice. It's a matter of personal choice, which those of us in America are grateful for. But I would add that you cannot say that it's a matter of choice unless we can make an informed decision. We need evidence-based, unbiased information to do so. We have beverage associations that spend close to $1 billion every year on advertising, and for us, this is about leveling the playing field. We need education so that we can provide our parents to make the best choice possible for their children. Then others will say, well, there are other issues in the city that are more important. I've seen this in the news, even in last week, that our opponents will say, well, to us in the health department, why are you not focusing on drugs? Why are you not focusing on violence? Why are you not focusing on other issues? Well, we in the health department do that too. We just had our city council hearing last week, in fact, about our budget, and so the city council has heard about the many efforts that we have across our city to save the lives of our residents. But for us, this is an epidemic. This is killing generations of our children, and we have to step up now and also address the number one killer here in our community, which is heart disease fueled by obesity. Now, finally, there are those who will ask, why should Baltimore go first? Why don't we let the rest of the country lead? Why don't we let Maryland lead? Why don't we let other places lead? Well, here in Baltimore, and certainly under the leadership of this city council and our mayor, Mayor Rawlings Blake, we have never taken a back seat to public health. Many years ago, 20 years ago, there was debate about needle exchange. And there were many who said, well, isn't this going to encourage drug use? Well, we said, we are about saving lives. We are about saving lives from hepatitis and HIV. And as a result, the percentage of individuals with HIV from IV drug use has decreased from 64% in 2000 to 8% in 2014. And now the state has followed us. Just this last session, the state has passed legislation to duplicate what it is that we've done in Baltimore City. Baltimore City has taken the lead when it comes to overdose prevention, when it comes to violence mediation, when it comes to getting glasses for all of our children. These are the things that we do because we believe that we don't just want to match what other cities do, we want to take the lead. And we want to make sure that our residents in Baltimore are benefiting from the best science and evidence that our pediatricians and public health leaders are saying. Finally, 50 years ago, the conversations, as Councilman Mosby mentioned, the conversations were the same about what's happening now. They're actually very similar. There were industry experts who are talking about choice. Then you have the public health experts who are talking about education. You know what that issue was at the time? That education, that issue that they were speaking about at the time, that fight was over tobacco. And now it is indisputable. Now we know that 50 years ago, 40 years ago, 30 years ago, that all those public health advocates, along with our city leaders, were on the right side of history. So I ask for City Council, for all of you as leaders in our city, as the people who all of us in the community look up to stand with us, to stand with the public health community, to stand with all the advocates, to stand with our families on the right side of history and approve this legislation. Thank you.
Thank you, Dr. Nguyen, and thank you for your leadership in the field of public health for our citizens. Dr. Maya, and I can't quite, all right, can you? I thought my penmanship was bad. Go ahead, doctor. And you're from the Global Policy Solutions.
That's right.
And where are they located out of?
Our headquarters in Washington, D.C.
Okay.
My name is Dr. Maya Rocky Moore, and for those in Baltimore, Cummings. I come to you here today as the president and CEO of the Center for Global Policy Solutions. We are a think tank and action organization that has been focused on public health. We have led for almost a decade a program called Leadership for Healthy Communities, a nationwide $16 million initiative focused on advancing healthy eating, active living, and childhood obesity prevention policies. We also focus on health disparities. So Chairman Curran, thank you so much for having me here today. I want to thank Councilman Mosby for your leadership in introducing this important bill, and also thank Dr. Lena Nguyen for inviting me to testify. You are considering a very, very important piece of legislation, and I stand in strong support of the warning label on sugary drinks. You people need to understand the link between the dangers of drinking sugary sweetened beverages and what's happening to their bodies. Understanding this link can empower people to make healthier choices while improving the public's health. The prevalence of sugary sweetened beverages like soda, sports, and fruit-flavored drinks has become so normalized that very few people think twice about consuming them. Everywhere we look, from television shows and movies where product placements are everywhere, to the corner stores where the sugary drinks are lined up, to advertisements in our communities. And I should also say, I come to you also as a resident of Baltimore. I live in Madison Park. And this overwhelming scientific evidence shows that they contribute to obesity, tooth decay, and type 2 diabetes. These conditions are causing unnecessary pain, suffering, and early death in our communities. There is no one I know in the African American community who hasn't been touched by obesity, who hasn't been touched by type 2 diabetes, who hasn't been touched by an early death related to these preventable chronic diseases. African Americans, who comprise almost 65% of Baltimore's population, are disproportionately impacted by these preventable conditions. In 2010, African Americans had a life expectancy that was almost 4 years shorter than whites, primarily due to obesity-related chronic diseases such as type 2 diabetes, heart disease, and cancer. Especially at risk are African American children, who are more likely to be obese, develop type 2 diabetes, and experience tooth decay than their white peers. There is strong evidence that children and youth are influenced by these advertisements that lead them to believe that it is harmless to consume sugary drinks on a regular basis. Moreover, research indicates that youths of color see more of these unhealthy ads and are targeted more heavily by sugary drink marketing firms and companies than our white youths. These beverage industry tactics contribute to an environment that undermines the health, longevity, and success of Black and brown kids and Black and brown communities in particular. As a result, the consumption of sugary drinks is not just a public health matter, it is also a civil rights imperative. I just want to say that the beverage industry argues that there is no clear link between sugary drinks and poor health. Most of this is research that they have funded. Meanwhile, independent researchers have found the exact opposite. The industry also tends to take the position that physical activity can compensate for consuming sugary beverages. And while it's true that exercise can help, it's also true that most Americans and Baltimoreans are not engaging in the amount of exercise needed to completely offset the consumption of sugary drinks. And the question of physical activity ignores the lack of nutritional value offered by these drinks, as well as their negative impact on oral health and those who may be vulnerable to developing type 2 diabetes. So I just want to end by saying that passage of this warning label bill will make Baltimore City a leader in the national effort to educate the public about sugar-sweetened beverages. And I just applaud you and encourage you to take this opportunity to build a healthier future for our children and for our city while serving as a beacon of hope, a leader for the country. Thank you.
Thank you, Doctor. Any questions for Doctor? I have a page of the proponents and a page of the opponents. I'm going to take 5 from the pro, and I'm going to go to 5 from the opponents to balance it out a little bit so that we can get a more rounded view. So the last one that voted, that signed in to testify for is Dr. Richard Steeder. Did I pronounce that right, Doctor?
Close enough.
All right. How you pronounce that last name?
Saphir.
Severe. All right, Doctor.
Thank you for having
Welcome
me.
to City Council Chambers.
Well, thank you for having me here today. I appreciate the opportunity. I'm coming to you as a member of the Johns Hopkins Medicine faculty, and I'm coming here to support a warning label for sugary sweetened beverages. I see kids in a clinic at Hopkins specifically for problems with cholesterol and triglycerides. I'm also responsible for having helped transform Johns Hopkins Medicine into a healthier beverage environment. Yes, sugary sweetened beverages has a negative impact on body weight, tooth decay, and diabetes, but it's so much more. There's more than 100 published articles in medical journals outlining the various ways sugary sweetened beverages has a negative impact on health, including kidney stones, heart disease, osteoporosis, reproductive issues, high blood pressure, liver disease, and asthma. It's for these reasons that Johns Hopkins Medicine 2 years ago took the bold steps of transforming its work environment so that there would be more healthy beverages available to the employees and the visitors of Johns Hopkins Medicine. We also provided labels, a little red sticker on sugary beverages with an explanation so that those who were seeking to purchase a beverage had the clear understanding of what was the healthier choice. I'm going to share just one story about one of my patients. Many of you here are familiar with high blood pressure. It's a silent illness, and I think most of us realize that. But there are other silent illnesses going on in our body. High sugar is often silent until there's a problem. High triglycerides are silent until there's a problem. These problems traditionally or historically have been in adults. And every week I am seeing children with these problems. And unfortunately, sometimes they're showing up in my clinic with a large cup from a commercial, let's say, coffee supplier, having a drink, and they don't realize what's in this cup. After a nutritional evaluation and guidance, many of these children return with their parents, having stopped consuming sugary beverages, and their triglycerides and their sugars have returned to normal. They just aren't aware. It's not a fair playing field. Nutrition is a very complicated area. Many people like myself went to school for 4 years to get a nutrition degree. To think that the average citizen can understand this without having studied this formally is really not likely. So, in conclusion, this legislation still allows choice. And just as smokers can continue to buy cigarettes, consumers will still be allowed to buy sugary beverages. Give parents and my patients a fighting chance. Help them know what decision they're making when they're choosing a beverage. Otherwise, they're facing a lifetime of illness. I appreciate your time today and allowing me to testify.
Doctor, before you leave, I appreciate Hopkins hospital systems are one of the best things we have going for us in the state, not just in Baltimore. And I always appreciate working with the Hopkins hospital systems because I know what they can do, and I've had personal experiences of what they can do. Is the Bloomberg School of Public Health also with you on this?
Yes, they are. In
Okay.
fact, the Bloomberg School of Public Health put 2 of their faculty members into our subject matter expert team when we did the transformation.
And just one observation, not to be critical of my friends over on Wolf Street. Recently, my wife had an operation at U Memorial. I was there for 2 days. And she likes Diet Coke. That's fine. I don't. So I got her Diet Coke from the vending machine. So I tried to get my beverage of choice. And it wasn't available in the vending machines. I went down to the cafeteria. It wasn't available in the cafeteria. So I do know that MedStar, and at least in U Memorial in particular, have banished the sugary drinks from their vending and their cafeteria. But that's not, you have warning labels over at Hopkins concerning,
Yes, we took a comprehensive approach. We employed multiple tenants to achieve our goals. I don't know if you want me to review them or not, but
right.
we increased the number of choices of healthy beverages.
Right.
We provided the labels that I previously mentioned.
Right.
We lowered the cost of water to make it more affordable to
Right.
buy water. And we also banished the advertisement of sugary sweetened beverages on the side of containers that sold beverages. So we were able to see, measuring our vending machine purchases, that we did see a reversal in the purchasing trends.
but you still have sugar sweetened beverages available.
20% of the choices in the cafeteria and the vending machines still are sugary beverages. That was intentional. We felt for the culture in which we worked and live, it was appropriate for people to have a choice.
All right, well, I'm just, New Memorial took it a step further. Thank you, Doctor.
Very good.
Thank you.
Thank you for having me.
All right, thank you.
Question?
A question, Doctor? Councilwoman Card.
Doctor, you mentioned asthma as being a possible product of high sugar in sodas. How does that
actually-
work?
So the lining of the cans which sell sugary beverages has a chemical which can incite an asthma exacerbation in some patients.
So it's the can. I'm not,
Yeah, yes, you can ask. Yes, it's the lining of the can. That's correct.
thanks.
Yep.
Thank you, Doctor. Thank you.
Thank you.
I'm now going to go to the page that has the folks that are taking against the position here, and I'm just going to go down in random here to Cowie Lock, Annapolis, Maryland retailers. Okay, welcome to City Council. And how do you pronounce your last name?
Kaylee Locklear Toll.
Okay, Cowie. All right. Welcome.
Thank you, Mr. Chairman, honorable members of the committee. Kaylee Locklear Toll here on behalf of the Maryland Retailers Association. And I thank you very much. Many of you I've had the opportunity to speak with. I'm going to touch on a couple points I've already made to you. This new mandate is only required in San Francisco, and this just happened in the past couple of weeks. I think you're all aware of this.
No, I wasn't aware. I have several other jurisdictions around the country that have
There was a court decision that
taxes
occurred.
on sugary, but I didn't realize that San Francisco was, okay.
The only jurisdiction.
And recently adopted?
Recently because of a court decision. I think this is relevant for us because it makes, in our region, this will make Baltimore City an outlier and will effectively drive business to surrounding jurisdictions. Warning signs and our retail stores will have to be located at point of sale, which are our cash registers. And this can truly be embarrassing for consumers who have made a decision already by looking at the label on the product to purchase it. And I bring this up, and I'd like to draw your attention to something that I hope is in all of your packets right here. And it's about federal labeling requirements that already exist. There are new guidelines rolling out here in the next 2 years. And I think what's important, if you look at that document, is that they pull out now added sugars on labels. So consumers can very clearly read what sugars are added to their food and beverage products. I want to add to this that the Food and Drug Administration has also found that American consumers show, and this is a direct quote, fairly high levels of awareness of the relationship between their diets and serious chronic diseases. We believe, and many believe, as has been talked about already today, that it should be up to consumers to decide what it is appropriate for them and for their families' needs and preferences. I also want to add that the Food and Drug Administration also recognizes that added sugars can, in fact, be a part of a healthy dietary pattern and recognizes that sugary beverages are just one of the many food items that contain added sugars. Councilman Mosby, you talked about the many factors that can contribute to obesity and diabetes, and I just want to say some of those out loud because often it is a combination of these factors coinciding that leads to these illnesses: overeating, genetic predisposition, lack of physical activity, not managing conditions, or lack of contact with primary care or specialist physicians, barriers to health care, lack of transportation, not adherence to medicine management, yet we are only singling out one of these factors. For us, and it's a question that I've talked to some of you about before, we feel that we should be asking how we can work together on these issues and grow Baltimore City together. Legislation like this makes it more difficult to conduct business in Baltimore City. It is ultimately more bureaucracy that is piled onto our shoulders and only works to prevent much-needed grocery stores, food markets, and retailers from staying and coming to Baltimore City. With those comments, we would respectfully ask for an unfavorable vote, and I'm glad to answer any questions.
Councilman Moses has a question. Is this the same product?
Excuse me?
Is this?
It sure is, yes. It's just an example that the
I know,
FDA gave.
But this is the exact same product that you do the side-by-side comparison.
Correct, yes.
And I see that the serving size is the same, and 2/3 of a cup, 55 grams.
Right.
But the total fat went down from 12% to 10%. How did that happen? And
So-
then, I mean, just hold on. And then the sodium stayed the same. The fiber content went down from 16% to 14% in the new label. How does that? I mean, I'm not trying to be critical here, but you put this here side
No,
by
I know.
side.
So this is just to make it very clear, this is a Food and Drug Administration document that they are using as an
Right.
example of how the labels are going to look different. So your
But it's the
first,
same product, is what I'm saying.
same exact product, absolutely. They bold out calories, serving sizes change by law, and you'll
Okay.
see under
Well, the
carbs.
service size, I'm gonna move on, but one of the most important things when I look at a product, and I've worked in the grocery stores for many years, I look for the fiber content. As say, and it's unusual, it went for 4 grams, and fiber was 16%, and 4 grams, and went to 14%. It's just strange. That's
It's-
all right. That's-
I'm glad to talk to you
Ms.
about it
Gibson
later.
will tell you, never put maps or charts in front of me, because I look at them. Councilman Mosby has a question for you.
Sure.
Hey, real quick. So the premise of the retailers' concern around, I guess, business and I guess the impact and
Sure.
the fact that we're saying that this is unfair for Baltimore businesses in comparison to surrounding counties, right? So is the thought process that me as a consumer, I'm going to decide to go to a restaurant in Baltimore County that does not have warning labels on the menu versus a restaurant in Baltimore City because it does?
Possibly. It depends what products you're ordering.
What empirical data, what studies, where are you guys getting this from other than out of the air?
Very respectfully, I think I would ask the council the same question in reference to these signs actually deterring people from purchasing a product.
Well, we've seen warning labels deter usage. One major thing that has been a huge victory in this country for decades has been warning labels associated with cigarettes. Again, it's not forcing a business to respond or react in a certain way. It's not forcing our consumers to live their lives in a certain way. It's just providing a extra layer of education associated with it. And I don't think that, me personally, I know that there's no studies that we can go off of. I'm not going to choose to go to a restaurant in Catonsville versus a restaurant in Hamden because of a warning label.
So if I'm a business, though, and I'm thinking about staying in the city, and I know that this carries a misdemeanor or $1,000 fine if I don't have appropriate signage, yes, that is something that is weighing into our businesses' minds here.
But there's no real overhead costs associated with it. Just do it. I mean, you have to print up menus, you have to print up signage. It's kind of just do it. I mean, that's like telling us, any other misdemeanor or any other civil penalty that we have on our books that, if you're in Baltimore versus another place, you better not go there because you can't do this. It's at the end of the day, just do it as a business.
And
This is right for the citizens of Baltimore. This is right for our children. This is not unfairly targeting your industry. The one thing I will say is I know you laid out a couple things earlier about the importance of of exercising, and the direct impacts associated with transportation and all the things you named. I mean, this is a variable in a very complex equation. No one is saying that this is the end all or be all to a healthier, better Baltimore, but we know that this is an important variable in that process, and it's the duty of this council, it's the duty of the city and of the citizens to ensure that we continue to chip away at those things. So we're not doing this as kind of just a isolated thing in a vacuum. At the end of the day, we need all those variables that are at play, and that's the point of this council, and that's the point of it. Again, I just deeply contest the fact that the retailers feel that this is providing an unfair advantage to them in comparison to their neighboring counterparts, as if consumers are going to go to businesses in Baltimore County because they don't have warning labels on menus.
The more regulations that are piled upon our industry, the harder it is to stay in the city. And I will flat out tell you right now, the conversations I have with my members, and we are majority small, by the way, is that they are struggling to stay in the city, struggling to keep their businesses open. There are major, major problems with grocery stores and food deserts here. And this is just one more thing that we pass that makes it harder for them to stay here in our city and serve our residents.
So, Callie, I've been very pro-business since I've been on this council. I have deep relationships with a lot of small business owners throughout the city. I understand and know the economic downturn and what last April and May has done to us and some of the patterns associated with weather, how it's impacted our small businesses. I just don't understand how a warning label is going to drastically exacerbate that at this particular point. I know the impacts that it will have as it relates to providing awareness to our children, to our parents, to our citizens about the dangers of consuming these drinks. I mean, we have kids who drink these drinks every single day, one or two of them every single day. We know those children are going to have serious health issues directly related to it in the future. So, I just, respectfully totally disagree with this idea, this premise that this is going to drive consumers to go eat in diners in Baltimore County or Howard County as opposed to Baltimore City because of a warning label.
I appreciate your position. Thank you.
All right, thank you, Gary. Mark Cooper from Canton Crossing. Welcome to City Council Chambers.
Hi, I'm here representing Canton Crossing Wine and Spirits and also the Baltimore City Licensed Beverage Association.
Okay.
And we're basically opposed to this legislation. Right now, the city's at a
Pull the
time
microphone
where...
down. Microphone, let me hear you.
Is that better? So right now, Baltimore City is at a time where it's having a hard time struggling to retain, as the lady said prior to me, retail businesses, grocery stores, liquor stores, convenience stores, things like that. We're one of the only cities in the country right now that is proposing anything like this. Personally, I don't have issues with health issues. I think it's great. We should be educating the consumer about that. But forcing retailers to comply with posting signage, listing things in beverages, it's creating an undue burden on us. Going back to the fines that are associated with it, I have 5 registers at my store. So basically, from my understanding is that I'm going to have to place signage at each register with the potential of, if there's no signage listed, getting a $1,000 fine for each register where there's no signage. And that could produce, undue hardships on my business to comply with that.
You realize that's the maximum penalty. They don't have to do the maximum penalty. No.
Understandable. But usually, when something like that happens, you're trying to make a point, so you're going to go to the maximum just to make an issue visible to the public. So it's also going to force us to give up counter space for these signs. We have limited counter space in our stores. So then we're taking up space that we could use for revenue-producing things to be on the counters. So, it could increase the cost for us to run a business, which in turn could lower our employee ratios. We may have to lay off people because of additional costs incurred. And so there's a lot of other issues that personally I see in Baltimore that could be addressed better with these funds versus from what I understand, the city is going to provide the signage. Well, signs aren't inexpensive. That's a big cost to the city right there if you're providing it for every business, retail business that serves sugar beverages in the city. You know, you could take that money, that could go to education at youth centers where you're educating the youth in advance to let them know that, hey, this isn't the best choice. There are better choices out there. And it seems like there's other avenues that might be better to educate the public versus requiring retailers to place signage at their registers. And then, you know, this is just the first step. Where do we go next from here? What is going to be mandated next upon us? For instance, we've already suffered from the bottle tax. I hear it every day from my customers coming in. You know, I can go to Baltimore County, Harford County, I can go anywhere else and buy the same products for less money, and they don't understand or accept the fact that our costs are increased because of these bottle taxes. So, you know, that's another thing that is just making it difficult to do business in Baltimore City.
Councilman Mosey has a question for you.
Sure.
So I totally agree with you as it relates to doing a direct comparison of Baltimore City as it relates to its neighboring counties, specifically on the bottle tax. So when we have taxes, you know, it directly shows. So as a consumer, I will decide to go to Catonsville versus on the city line to pay 5 cents less for a particular drink as opposed to in county. I get that. But this idea, again, that we're going to be driving consumers to Baltimore County just because they don't see warning labels on menus or on registers, to me, is a argument that just doesn't really hold much weight. During your discussion, you said that as a owner of a store, you would incur additional costs. What would those additional costs be?
Well, you know, I'm losing space, so that's an additional cost because I'm taking away space from sellable items that I can place on my counters to put these signs in place. And from my understanding is one has to be at every register or point of purchase in the store. So if you think about it, you're taking up square footage from that's available for retail purposes.
I mean, we're saying it's minimum square footage. Is that accurate? I mean, we're not talking about a 8 by 16 sign. I mean, it's a small sign that's that the consumer can read. But to say that that's directly impacting the overall revenue of someone's business, to me, again, is a huge stretch. Do you agree or no?
To a certain degree, but the bottom line is it's the consumer's choice. Because
totally, and that's what I believe this warning label does. It just provides them with the choice of providing them the information associated, just like.
But there's other avenues to provide this to the community through education, through educational services at after-school places in the schools. There's a lot of different other avenues to get this message out to the residents of the city versus placing it in a retail establishment.
Yeah, so again, I think that, one, I agree with you, but I don't think that they're mutually exclusive. I think that we can do both and that we should do both. I mean, I think that that's our duty, again, trying to grow a healthier city. The last thing I'll ask about is when you talk about, more or less I make a point. When you talk about the cost to the city of Baltimore as it relates to the production of these paper signs, minimal cost to the city of Baltimore. But when you look at it from a healthcare perspective, when you look at from all the issues that impact our city as it relates to schooling and the fact of absenteeism rate, when we talk about all the social services around health, when we talk about all the things that we have to add up and pay for things that are preventable, like diabetes, it far outweighs the production of these paper signs.
No question about that, but also education in the schools and the public forums could alleviate some of these costs.
Again, totally agree. So I don't think that's mutually exclusive. So, saying that when we have these warning labels on menus or in stores, that is not us saying that we need to stop communicating to our children the importance of healthy and balanced diets.
Right. And, my industry is a little different. I don't have children coming into my store for the majority of the time. It's adults, it's a liquor store. We don't have children coming in and purchasing drinks or anything like that there. So maybe you could look at the types of retail establishments you required this. I mean, granted, I do sell sodas, but it's a very, very small percentage of what we do, and we're not selling it to minors because most minors don't come into our store.
Correct. Understood. Thank you.
Oh, just a quick question. I apologize. It's been a while since I read the bill. What is the size of these signs we're talking about, these counter space signs?
We don't know. We haven't been told yet.
Does anyone know how big they are?
Andrew, do you have one?
Now, I'm embarrassed to say this because I misunderstood. I thought you had to put a sticker on every bottle that
No.
had sugar in it.
No, not at all. That's one of the.
Maybe we should. And then we could leave the counter space empty.
This,
I don't know.
this is not
So,
going to
Is this?
impact revenue.
This is the sign. Well, wait a minute. What do you, scotch tape it on or what? I don't know. It's a sticker? Oh, like a bumper sticker. So it's not attached to a specific beverage.
No.
This is the
in
first time
store
we're
on
seeing
the
these
menu.
signs.
Oh, I thought there was like a warning like on cigarettes. I thought that you put it on a heavy sugar bottle, like in somebody. I'm thinking, no wonder there's a problem because your clerk, who's going to put all those stickers on all those bottles? Honestly, I did. But is this what you're worried about?
Well, it doesn't go with the theme of our store. It's, it's kind of out in your face, whereas we're a higher end store, and that doesn't necessarily fit with our.
It's not the mood you want to create when somebody
Exactly.
walks in to buy a gin. Or,
Right. Hey, warning,
beer.
don't come in here.
Well, I don't think, I don't know about your business, but I don't know about the size of your counters, but I think you can fit this. Now, you might not like it, but I think it fits. And you don't have to put these, like, small versions of these on every bottle?
No.
No?
No.
Like with cigarettes?
No.
Okay, I honestly misunderstood, and I apologize. It's been a while since I read the bill.
It's okay.
Oh. I swear to God, I thought they would have to put it on every bottle.
And is that Kane, the last name? Not Sugar Cane.
That's cool.
Her name is Sugar.
I'm not that sweet.
And you represent the Sugar Association.
I do.
Welcome to City Council
All
Chambers.
right. Well, thank you for the opportunity to speak to you all today. My name is Dr. Courtney Gain. I am a dietitian. I have a PhD in nutrition, and I am the president and CEO of the Sugar Association. When I was 18, I sat next to an obese man on a plane, and it made me sad and it made me mad. And I went back to school and I switched my major to nutrition, and I became a dietitian. But it was the science that was the hook for me, and I wanted to know more and more, and so I stayed in school for 11 years studying nutrition. Nothing about me has changed. I still have a passion to halt the obesity crisis, and it's still the science that keeps me going every day. What I learned in those 11 years of school and now 20 years in the field is that nutrition is incredibly complicated. And both the cause and the cure for obesity are even more complicated. I came to the sugar industry 2 years ago because I saw what was happening to the conversation around obesity. The science was being distorted, and as a scientist, I was angry. I thought with my background, I could help bring science back to the dialogue and take away gut feelings, hunches, and emotion. This has not been easy. We are all desperate. And sugar is seen as the low-hanging fruit in the fight against obesity. Blaming sugar for all of our problems is trending right now. Its role in the diet is not that well understood, and therefore it's seen as non-essential or empty or discretionary. In some cases, that's true. Some people, many of their excess calories are coming from sugar and from soda specifically, but it's not the case for the majority. Less than 5% of calories in children's diets are coming from soda and sports drinks and energy drinks, with 95% of children's calories not coming from soda. Will putting a warning label there really curb obesity? A warning label on soda, in my opinion, will serve as a green light for everything else to be consumed without consideration for calories or nutrient composition. Cheeseburgers, French fries, potato chips certainly come to mind. Nearly half of the children in Baltimore are overweight, yet, as written in the bill, only 25% are consuming a soda or more per day. What's not talked about is the fact that soda consumption has declined 39% since 2000, and consumption of caloric sweeteners is and has been sharply declining for 15 years.
Can you define that term, caloric sweeteners?
Caloric sweeteners would be anything that is a non-nutritive, so sugar, high fructose corn syrup, agave, honey, maple syrup. Those are probably the most common caloric sweeteners. Yet while soda has gone down and caloric sweeteners have gone down, obesity rates continued to rise during this same period. But most importantly, I need to point out that there's nothing special about sugar. It does not uniquely cause obesity or tooth decay or diabetes. Fundamentally, the wording of the proposed warning label is misleading and not grounded in anything more than a selection of weak science, and it doesn't tell the whole story. It's fundamental that children learn that their body weight and its health consequences are grounded in the relationship between how much they eat from all sources. And I know it's branded the industry tagline, but to say physical activity is not a part of this equation is really misleading, because it certainly is. This relationship between how much you eat and how much you move is that simple. And that is where our efforts should be. Scaring the public, and particularly children, to thinking that a serving of one food or beverage has more of a negative impact on their body weight than another with similar calories is misguided. Overstating the science and oversimplifying what it takes to have a healthy lifestyle is an irresponsible public health tactic. We should focus our attention on educating American children on the importance of achieving energy balance and giving them the tools they need to succeed at it. And that's all I have to say. Thank you.
Any questions for the
I do.
I do.
Nick and then Mary Pat?
Thank you for coming. Thank you for coming and testifying. I think part of the testimony was a little offensive. I think that particularly folks in the Baltimore City Health Department and many of the advocates around the room have spent a lot of time, not just with weak science. I think is that what you said? Weed science or weak science?
Weak science.
Weak science. Yeah. Tons of folks, and I think that we should be able to agree to disagree, but I think there is empirical data that directly show the linkage. The one question I have is, you presented the fact that 5% of children's calories come from sugary drinks.
Yes.
What percentage of sugar ingested come from those drinks in the same children? Does that make sense to you? So right now you're saying 5% of a children's diet, the calories, come from the consumption of these drinks. Right. My question is, how it relates to all of the consumption of sugar, how much of it comes from those types of drinks?
Oh, about
Does that make sense?
Yeah. So of about 35% of their total sugar, 40% is.
Because I think that that's a really important statistic for you guys to also kind of counter that with, because it shows folks that our children, as it relates to the consumption of these drinks, are getting literally 40% of the sugar that they're intaking on a daily basis from soda or from these sugary drinks. And that's important, I think, to kind of highlight. Do you think so, as someone in the science?
Well, I guess with all due respect, I don't think I was being offensive. And this is the problem.
I didn't say you were offensive.
No, you said my testimony. I'm just saying that the facts are the facts. And of course, the bill omits several of the facts as well. It's impossible to give the whole entire body of literature, whether it's in a 4-page written document or in a 2-minute testimony.
Understood.
I do think it's important to get the breakdown of, everything that's in a children's diet. But the point is, there's 95% of calories that aren't being talked about when you put a warning label.
Totally agree.
No, it's an interesting point.
Yeah.
but I don't think it's essential to what I was presenting today.
Okay, I just think it's a good comparison. I don't know, that's something that jumped out to me. And I didn't think that you were intending to be offensive. I just think when you say weak science, and we have medical doctors, and we have scientists, and folks that have spent a lot of time, and maybe they're on the different side of the discussion, to call their kind of findings weak science, I think that's all I
As you
took
can
away from it.
imagine, as the doctor representing the Sugar Association, a lot worse has been said than weak science about what I do.
Totally agree. And I think we've been down this path again with tobacco over and over again, and it's kind of the same thing.
Actually, I'm going to stop you right there. Tobacco and soda or added sugars are not the same thing. And I think that's part of the problem, is the lumping together. And it's a little bit, no offense, but ignorant of a discussion.
I'm not offended at all. I think that maybe you've jumped to an assumption. When I said are the same, meaning that they're scientists and folks that have educational backgrounds and done a lot of research on two different sides of the discussion. So
Well,
that's-
earlier, it's they've been lumped together in this discussion
Yeah,
today.
but that's not what I was just saying. That's why I said
Okay.
maybe you jumped to an assumption. The last thing is what I want to say, and I don't think anybody in this room has said this, is that physical activity does play a role in it. And again, I said that this is a variable in a very complex equation, and I believe so. Physical activity is directly inside of that equation. I haven't heard anybody say that on this up here or has testified. So again, I don't think that this bill and this hearing is about sugary drinks, and it's about the things we've talking about. However, this is not a one-trick pony. This is a very complex equation, and we've identified sugar as something to talk about today. But thank you.
Councilwoman Clark, did you have a question?
Yeah, is it Dr. Kane?
Yes.
Dr. Kane, look, we know that this is what this concern is about, is an industry that we're very familiar with and very concerned about, that employs a lot of people and that is worried about any erosion from a local source of a national marketplace. I mean, we get that. We know what we're talking about here, but just to talk about sodas for a minute, the soda part.
I'm going to actually interject.
I'm not asking you to
I'm not
agree.
talking about the industry impacts, because you may not know that sugar is in fewer than 10% of sweetened beverages. So this bill won't.
I feel
I'm
better
defending the
because-
science on the warning label, which is not accurate, and the concept of a warning label. So I'm not talking about the industry.
Not worried, because I was thinking about Domino and all that and those
We're
jobs.
we're in very small amounts of sweetened beverages.
Okay, well,
Yeah.
But it's still the same impacts on children.
But I'm not here talking about the industry impacts. Yeah.
Well, I just
Okay.
wanted to make that observation and concern, and then say, look, I think what it is with the sodas is that they're addictive and affordable for kids. That basically kids they'll drink a lot of sodas. In other words, that's what they're going after. They can afford it. It's at the store. They're drinking it. They want another one. I don't mean addictive like cigarettes or heroin or something, but just a habit of what you do, what you drink, especially some of these athletic kind of like jock kind of drinks. And so it's whatever the statistics, it's the cumulative effect on a given kid of that kind of many sodas in a given day, week, whatever. Whatever the statistics might be on a flat line, it's kind of like, yeah, but a lot of our children, they're going down to the store and they're buying sodas, and then they're coming back and buying some more and drinking them, and it's happening, and we're worried about what it's doing to their health and to their future. So I appreciate what you have to say and all the work you've done, and I'm sorry about that guy on that plane, really. I know what you mean, I guess. But I think, I mean, we banned public signs on cigarettes and alcohol here in Baltimore City. billboards. But, I mean, it was hard to do that, and that right to do that is not going to extend to SSBs, and nor should it. But, so, is it better to get a voluntary, now, just hear me out, it wouldn't take space on a counter, and it wouldn't take a sign that says warning, just a voluntary ban on advertising those kinds of sodas in Baltimore City.
I just encourage you to read the written testimony with a lot of the data that are current, including that soda in 2015 hit a 30-year low. So there is educational efforts broadly to reduce beverage consumption that's working. So having a warning label that is not grounded in fact is not a
That's
solution.
not what I'm asking.
No, I guess I didn't get a question from you. I'm just encouraging you all to please read the written testimony with,
My
with the
question
science.
was, would it be better to ask for a voluntary ban? We're not going to legislate a ban. We couldn't and we won't on SSBs, but a voluntary ban from the industry on SSB advertising. Period.
Well, I think as was in my oral testimony and is in the written, just a singular focus on a product when there's a lot of other factors at play is misguided. So I guess that would be my answer.
Well, I got it.
If there's no advertising of soda, as I mentioned, there's still cheeseburgers and French fries and lots of other sources of calories.
But we're talking about SSBs here today.
Yeah, so no, I would not support, no. I don't support the single product focus.
Asked.
Yeah. So, any other?
It might be an alternative.
Doctor, one final, you represent the Sugar Association, is that also beet sugar folks?
Yeah, both cane and beet sugar.
Cane and beet, and what about the high fructose?
No, that's the Corn Refiners Association.
Now, as a nutrition doctor, this says high fructose corn syrup, this has cane sugar. Are they equally as problematic for someone to have high fructose or cane sugar? Are they equally as?
At normal levels of consumption of added sugars, which is currently 13% of calories, there's data that show there's no difference.
There's no difference, okay.
They taste different, though, if you've ever had Mexican
I know
Coke.
they taste different. Thank you.
All right, thanks.
Two more folks from the against side. We're going to go to Kirk McCauley from the service station dealers. Is Kirk here? He may have left. Are you here, Kirk? Okay, you're representing the service station dealers. Is that correct?
Yes.
Thank you.
Name's
Well-
Kirk McCauley. I represent service stations, convenience stores.
Right.
In the city of Baltimore and the state of Maryland.
Okay.
My members are very concerned about it, this bill. The small businesses that they run and operate,
Use the microphone. Yeah.
pull
Hold the microphone. Pull it down to you. Yeah.
the small businesses that they operate have been under a lot of pressure in the last year. This is just one more item that they have to worry about. $1,000 fines, space taken up, prime space taken up with signs that really, when you think about it, the label is already on the bottle. It tells you exactly how much sugar's in it. Do we have to reinforce that with a sign? If the health department wants to do advertising, let them use public service announcements for that. It seems like it'd be much more effective and it wouldn't take up our space. The city has a lot to worry about. Small business has a lot to worry about. We have high crime. We have loitering in our parking lots. We have drug use in the city, opioids running crazy. The health department says they get 1,000 calls a week just for drug abuse. The people need help. Why are we trying to make fines on small businesses, the very people that keep the city running every day? Why are we trying to punish them for doing what they're supposed to be doing? Why aren't the city paying attention to the things that really matter, the crime, the drug use? This is a great city, but it needs help. You have the power to help it, but putting sugar signs in small businesses is not going to do the job. You know. So I don't have a whole lot else to say. It's I sent the council all a letter, so you know what that is, and I'm not going to repeat it and take up your time, but there's a lot more things pressing this city than signs and
Any questions for, okay. Thank you. Thank you for coming in today.
thank you.
And to back clean up for the opponents or the, of the measure, Miss Ellen Valentino, are you here still? There you are. And then we're going to go back to the proponents, so we're going to go back and forth on this. We're not going to have all one-sided. This is the fifth one of the opponents, and we're going to go back to the proponents. So hang with us. Thank you, Ms. Valentino.
No, thank you, Chairman.
Maryland Beverage
Kern.
Association.
Yep,
Okay.
that's who I am, Ellen Valentino, and I am here representing the Maryland Beverage Association, including the local Baltimore City beverages. And I want to start out by saying to Dr. Nguyen and the proponents in the room, we share your passion, but we disagree with this legislation. I want to talk a little bit about who we are, and I think honorable people can disagree. Okay, I do. But I think it's important that people take a long look at the content of this legislation, what it really does do, the whole gasping sweep of the heavy-handed mandate, because it is. It's not just a simple sign. It's much more prescriptive and much more in-depth than I think what you've heard here today. And I think it's important to focus on that because we are talking about every vending machine, every cooler that's in every stadium that goes around. You know, people are entitled, and I'm going to talk about this a little bit because I think it's important. We're okay with the products we make here in the city. We make it all. You know, if you go to the grocery store, there are so many different choices to choose from, so many different sizes, low calorie, no calorie. I mean, there has been an entire evolution, we call it a bevolution, get a smile out of some people here, that has taken place from our industry over the past 20 years. And I do think it's a mistake and a bad public policy to focus on these local products, our products, because I think it's a missed opportunity and sends a wrong message. And science does matter, but facts matters too. And full-calorie soft drinks have significantly declined, but obesity continues to rise. So I say to the proponents, I think you got the wrong guys. We're here. We're your partners. And I want to talk about the initiatives we're doing here in the city, okay? We have voluntarily, at the tip of your finger, you can see the calories that are in almost in every beverage. That was done by the Beverage Association without legislation. If you look at the vending machines downstairs, and you'll hear from the local vendors later, you have another initiative voluntarily bought by the industry that says clear on calories. We want you to know what you're purchasing, and we want you to have the choices that you want to make. So additionally, a new initiative that we partnered is taking our marketing, okay, collaboratively as an industry and working to reduce everybody's calories from beverages over a period of time. I mean, these are initiatives that are meaningful and real solutions. So I guess in sum, just quickly to walk you through the bill, it is scathing. It is hurtful to business. It will deter people from purchasing, shopping, and making a purchase here in the city. It sends the wrong message. You know, we talked about exercise. You know, I would think the efforts here today would be, hey, let's hand out a sign that says, don't forget to exercise 30 minutes a day. You know, by sending a go sign on all other products, looking at an industry that has evolved, that is the leader here actually, with respect to innovation, with respect to our commitment to the health and wellness space, looking at local companies. You know, I've heard and been frustrated this week. I think some of you have heard my frustration. We want to be at that table. We've asked to be at that table. Comparing the products we make to other serious issues that are facing the city is misguided. And with that, you know, I will answer questions, but know this, okay? You have our commitment. You know who we are. You know where we are. You know what we make because you can see it in the beverage aisle. And you know that as an industry, we are the national leaders moving forward. This sign is a misguided effort and a missed opportunity to send a real message to the public. So we are against it. And I will answer any questions. And I always got to say this, and I, you know, we think it's okay on a Sunday afternoon at a ball game if somebody wants an ice cold pop. We think that's okay, and so we are proud of all the different brands. And like I said, take a stroll down the beverage aisle. Councilmember Clark, I think you'll find a quite surprising move in a great direction. So with that, I will answer any questions you
Councilman
have
Clark,
about us.
I'm sorry, Councilman Mosby has a question for you.
Councilman
Mr.
Mosby.
Valentino.
Just more of a statement. So I totally agree with you. I think it's
Yeah.
great for someone to drink anything that they
Yeah.
want to drink at a game. I mean, I'm not sure why this is coming across, and maybe there's been miscommunication. No one is saying that no one should ever drink these drinks. No one is directly attacking
Yeah.
your industry or your drinks. What we're saying is just providing citizens another layer of awareness associated with the issue so they can make responsible decisions for their lives. I think you brought up a good point, and I'm wondering if you're willing to provide a friendly amendment to the bill to add to the warning labels the fact of the importance of exercising for 30 minutes a day. Is that something that the Maryland Beverage Association would be willing to offer up as a friendly, so this is not just directly
Yeah, right.
attacking the drinks, but it's
Right.
also exposing the importance to exercising? So I think that was a great
Sure,
point,
sure.
and I'm willing to take that friendly
Sure.
amendment to
Right.
add it to the warning labels if you guys are willing to support it.
Can I respond?
Yes.
Okay, I'm gonna take a breath here. Because you're wrong. People are attacking our products here. They're sitting in this room, okay? They have indicated and compared the beverage we make here in the city to heroin, okay? To heroin. They have showed films that morph the products we make here into guns, okay? So let's be clear on what's happening here, okay?
I'm not aware of that.
No,
I'm
listen,
not aware of that.
listen, I'm just telling you the effort that's afoot. So I understand you're an honorable man, and you and I have had good conversation. But I want to be clear. What is happening here? They've asked us, proponents specifically, have advocated for us to leave the city. Okay?
To leave the city?
To leave the city. Shouldn't make these products here. So I want to put that aside.
Who are these
with
people?
With respect
people
to
here today?
some of them are. They are. So with respect to your friendly amendment.
Do you
okay?
mind letting us know what
Yeah,
organizations
I will.
they represent?
You know
or-
what? To be quite candid, I'll send you tweets, face mails, and videos, and you can take a view. But can I take a step back on the
Sure.
warning label as well? Okay. Why would you want to send a message singling out one product that is on the decline and not send the overall message of what's important, number one? And when you go to a restaurant, and the restaurants are here, they can speak for themselves. I always try to stay in my lane of who I am,
Yeah.
who I represent, okay? Menus, people are going out to have an enjoyable dinner, and you're asking them not to make a purchase at that local restaurant. You're sending them, hey, oh yeah, the bill is clear, okay? Warning before you make the purchase. So I'm gonna let them speak for themselves, they're here. So no, I would not advocate or support a new mandate on grocery stores or small businesses here in the city, I won't. But what we will do is this. Again, love nothing better to come forward with the programs we have, talk about the products we make. Maybe we could go on a market tour so we can debunk some of the things that have been said here in this room where products are being sold and when they're not being sold. The city does have a serious problem.
Yeah.
And the serious problem is grocery stores. And so the issue becomes not whether products are available in different neighborhoods, it's getting a grocery store to that neighborhood. So I am not in support of a new mandate on businesses, new legislation, or any additional costs on the city.
Okay.
I'm just not. Thank you.
Understood.
Thank
the
you.
Only thing I want to say, just to clarify,
Yeah.
is that this warning label does not call out any product. It just says drinking beverages with added sugars.
Yeah.
It doesn't call out any product or any specific product. It doesn't mention any product. It's not on any product. It's not on any packaging. It's just providing a warning label
Councilman-
about the importance.
Right.
I mean, this is no
I-
different than,
yeah.
this is, if you could let me finish, this is no different than the importance of folks shouldn't add sugar to baby bottles, water sugar bottles. Or I mean, this is just saying that drinking beverages with added sugar contributes to these things. So I think it's really important for us to just ensure that we're on the same page to say that this warning label is not calling out any product or any particular industry.
I know.
There are industries and folks who represent products that obviously are taking a concern with it. However, the intent of this is not to call out particular
Right.
products.
Count-
At least as the author of the bill, it has never been my
Right.
intent.
I appreciate that. Just one closing
Good.
statement.
Ellen? Good.
There's a blown up Coke can outside that defaces the products that are made over here on the other side of Baltimore. And so it is. The title of the bill is. The conversation around the city health department is. But I hear you. I respect you. And I know that you and I have had some difficult conversations about this. If you believe this is not about soft drinks, and when I talk about it, people think it's about soda. There's over 500 products that this speaks to. This is about lemonades, sweet teas, and other products just as much. But I want to leave you, because I don't want to leave with you like in a combative way, because
No,
you and I,
it's not.
right. But I disagree. I've seen this campaign. I've heard the city's health director's interviews. I've been to her forums, and it is about us. And I know that you may not be, you weren't at those forums, you haven't tweeted out. I respect that, I understand that. This is about us. But I want to leave you, finally, we care. We're doing our part. Please, I urge you to not move forward, bring us to the table. We're probably the best partners you can have in the city because we have stayed, we care, and we got real programs, real solutions, and good products, by the way, good products for you. Thank you.
So again, just to clarify, no, you are lumped into this because you represent an industry that has drinking beverages with a lot of added sugar. The point of what we're trying to say, it's not particularly calling out your particular product. If we were able to invent a new drink tomorrow and we put sugar in it, it would be lumped in it as well. So unfortunately, I think that it's been about product, and what we want to say, it's not about product, it's about drinking beverages with added sugar, and it's not about any particular product.
I appreciate that you.
Yeah.
I
And if you
appreciate-
notice, the can or the balloon that you referenced wasn't in the shot for the press conference or anything like that.
Councilmember Mosby, you know, I
Yeah.
say this with a smile. I hear you, but I know that you hear and see what I see. And I know that you've removed, I don't want to say you removed yourself. I know that you're committed to passage in this legislation, and I know that you are committed to a real solution. I'm here for the real solution. I can't be here for the passage of the legislation.
Understood.
Thank you.
Thank you.
Thank you. I'm going to ask Councilman Costello to chair the meeting for a few minutes while I take a break, and we're going to go back to the proponents. But before I do that, I want to read a blip from a Wall Street Journal article concerning San Francisco's effort. It says the soda industry fails to stop San Francisco law targeting sugar. And it was about a few weeks ago, but I just want to read excerpts from it. It says, the San Francisco ordinance will require the health warnings to cover 20% of public advertisement in the city, including posters and bus shelters. The warnings wouldn't be required on television ads or on beverage packaging or menus. City officials voted unanimously in favor of the measure last June and banned city departments from purchasing sugary drinks with the city funds. The city dropped another ordinance prohibiting ads for sugary drinks on city-owned property at the Beverage Industry Challenge. In last month's ruling by the judge, because the sugar industry challenged it in court, Judge Chen wrote San Francisco, quote, has a legitimate interest in public health and safety, and that the city, quote, has a reasonable basis, unquote, for identifying sugar-sweetened beverages as a cause for obesity, diabetes, and tooth decay.
Are you asking me
So-
to comment, or are you just
Sure.
reading a statement?
You saying our friends from San Francisco are
Okay, I
too
think
far
you're.
out there?
No.
Yeah.
First of all, I do want to say this, and I say this with all sincerity. Okay, it's a big difference between San Francisco and Baltimore City right now, and that means Baltimore City is working very hard to retain their grocery stores, to keep people coming to eat out, to make people feel good about the city. We feel good about the city. We're your partners with that. And they're facing a lot of challenges that I would think that may be a little different from San Francisco. But yes, we were part of that challenge, and I don't want to get into it here today. I'm sure there's a memo. I suspect there's some potential issues with this legislation too. Very familiar. We opposed it. We opposed this, and these are not the same bills by far. Not the same laws.
Now,
Thank you.
just on that vein,
Sure.
I know that other cities have done a sugar sweetened tax, essentially.
No, I find that, let me,
But you're aware other cities have done that?
no, they have not. They, right now, to the best of my
Philadelphia, I'm
knowledge,
looking right at Philadelphia.
that's pending.
I
And
got
that,
the city of Oakland.
if we could just take,
Hold on,
you
hold
said
on.
pass, you said pass. And you know, Baltimore City has their container tax, right?
And I got
One of the
Maui
only in
here
the same,
too. I got
know.
Maui from
Right,
Hawaii
yeah,
in here
yeah.
somewhere.
Right now,
I'm just
if
letting
you
you know
no,
that
if you're
other-
asking me if I
Sure.
think that, if you're asking me if I think there are a handful of legislative initiatives out there, I do.
Right.
There's also been a handful of initiatives out there that have been defeated because what the consumers tell us, they don't want any more taxes. They don't want any more, well, that's another hearing. But they don't want any more taxes. They don't want governments banning, telling them what they can eat or drink. That's what they tell us.
And we agree.
And so I think,
I agree.
then
I
I
don't
look
want any
forward to work with you
taxes.
outside of legislation.
I don't want to ban anything.
I appreciate it.
I don't want to tell anybody what to do.
Yeah,
This is just
yeah.
a warning label.
About the products we make here in the city.
But see, hold on. It's not about the product.
It is.
It's about the ingredient.
Yeah.
And the ingredient is the sugary content. So it's not about the product. If you take a
Right.
product, you take
Right.
any type of food, any type of menu, several ingredients go into making that.
Right.
So this is not about the product. So I just don't want to make sure that we're not taking it personal. It's not
Right.
about any
Alright.
particular product.
I got to quit while I'm ahead, but we take it personal here.
No,
On
we're
this
fine,
stuff.
we're
We don't
fine.
take this no, I mean, I don't take it personal. I'm just speaking on behalf of my companies. We take it a little personal.
All right.
All right, thank you.
Thank you so much.
Thank you, thank you, thank you.
Councilman Costello will host a hearing for a few minutes till I get back. Thank you, Councilman.
Antoine Dow from A and Miss Dot's Grocery. Sorry if I mispronounced your name.
Yes, how you doing this evening? How y'all doing? Yes, okay. Yes, I'm from the Druid Heights area, and I'm just shocked that there aren't other businesses representing the area. I am for this legislation. It should be passed because I see firsthand what the damages of these sugary drinks are doing. I also own a barbershop. Now, this is a quick story. I had a client, she had a young man, and they diagnosed him with ADHD. And she said, my son don't have ADHD. I said, I know he don't. I said, what you do is take him off the sugary substances. That's no sugary drinks. Because every time he would come to my barbershop, he would have a canned soda. I own a grocery store. So I felt partly responsible. That was in 2007. I've changed my menu. We offer a healthy choice menu. Right now, that young man is doing well. He was on his way to taking ADHD medication. Do you understand? You know what that means? So, yes, I'm for it. And I'm just, like I said, I'm shocked. In my neighborhood, I have the only African-American grocery store deli in the neighborhood. So the other merchants really don't care. They don't care what they sell you. They don't care at all. And I'm just telling you from personal experience, I've tried to reach out to a few other stores in the neighborhood to change their menu a little bit and do a healthy choice menu. You're not gonna lose any money. I just saw the warning label. It's not a problem. It's not gonna hurt business. I heard everybody else speak, but no, it's not gonna hurt business. It's nothing to be afraid of. If you kill your customers, you're not gonna have any customers. It's just true, So I'm passionate about what I'm saying, and thank you.
Thank you, Mr. Dow. Aroma Igwe from the Maryland Dental Action Coalition. One more time. All right, I'm going to move to the next one, Andrew. Kara Shipley from BHCK.
Okay, first I just want to say My opinion is made in a personal capacity and is independent of my affiliation with Johns Hopkins Bloomberg School of Public Health. Hello, members of Baltimore City Council Health Committee. My name is Kara Shipley, and I'm a registered dietitian and the coordinator of the Be More Healthy Communities for Kids program at Johns Hopkins University, also referred to as BHCK. I'm here on behalf of BHCK and Dr. Joel Gittleson, the leader of this project who could not be here today. The Be More Healthy Communities for Kids program is an obesity prevention program operating at multiple levels of the food environment in 28 low-income areas in Baltimore City. We work with 28 corner stores and 14 carryouts to improve the access to, demand for, and consumption of healthier foods and beverages. From our work, we have learned that stores that have introduced new menus that highlight and promote healthier beverages, sides, and combo meals have showed an increase in their total revenues. The warning label proposed by this bill poses no additional cost to the consumer or the retailer. We believe that it will have an impact and healthy substitutions will be made. Customers will continue to purchase drinks from local stores, even if it's not a sugary drink. A concern that some have expressed in the impact of this bill will be impacting businesses in the city. Will they lose money? Overall, the small store and carryout owners we work with are not worried about this bill hurting their businesses. Small store owners care about their community and want to provide them with the education they need to make healthier beverage choices. They think that the healthier choices will be made by their more conscientious consumers. Mazar Hayat, the owner of convenience store, phrased it this way: "We need to let people know what they are drinking so that they can make healthier choices. This label will give people a chance to understand what they are consuming." We ask today that you support these small store owners who are trying to make a healthy change in their community and improve their business with new healthy products. We have one of our owners joining us today. He's running a little bit late, but he will be joining us later. So thank you so much for your time.
Andrew, do you find... Okay. Aaron Mabin from Project Mayhem.
First of all, thank you to the chairman, thank you to Councilman Mosby, and thank you very much to Dr. Wynn for having me. As a resident and community advocate for the rights of the people of Baltimore City, I pay very close attention to the issues that most drastically affect our citizens. More than any other issue, we face an epidemic of physical diseases that stem from what we consume in our diet on a daily basis. All people need nutritious foods and drinks, no matter who you are, no matter where you live, or how much you make annually. But here in Baltimore City, the skyrocketing rates of chronic disease like diabetes, obesity, and heart disease serve as testament to the fact that many of our people still lack the basic knowledge to make the choices that will benefit their health. Many of my friends are social entrepreneurs and small business owners who have dedicated their time, energy, and efforts to supplying our people with high-quality, healthy food and beverage options because they realize the importance of what we put into our bodies on a daily basis. As more information and statistics about what we consume and how it affects our short and long-term health become available, there is a change in the demand and necessities that are needed in order to change the trend toward healthier lifestyles and living longer lives. Yet, in order for this city to make these widespread gains in health, the public has to be educated about the healthy options, and they must be provided with alternatives to the status quo. But because of low food access, predominantly in our corner stores that are run by people who really don't live in our community, all of our choices are usually stripped away and replaced with the ingredients of diabetes, obesity, heart disease, cancer, and death, poisoning our people and our children a little bit every day. Why is it easier in my own neighborhood to get a soda, a pack of cigarettes, or a bottle of liquor than it is to get a bottle of water? Why is the most accessible food options for our children in low-income families in this day, day-old fried chicken and a take-your-pick buffet of high-fructose corn syrup beverages? Is this the case downtown, or in Canton, or in Mount Vernon, or in Federal Hill? I'll answer it for you. No, it's not. And if we really care about the health of our citizens rather than that of a select few, then what efforts are we tangibly making to provide all of them with the ingredients of what makes up a healthy lifestyle? I see a lot of representation in this room of big soda businesses. How can we be comfortable being on the wrong side of history? At the end of the day, all of our people that are here that are advocates of this bill being passed, they are doctors, they are educators, they are people that have given their lives and dedicated their time and energy into the research necessary for us to make these informed decisions. That research has shown us that if the public really knew what was in those drinks and what it does to our health over a long period of time, through the provision of warning labels, many of us would demand healthier beverages. Warning labels provide accessible and easy to process information about health implications of their beverage decisions, empowering this city and its residents with the power of knowing the effects of the products that we are putting into our bodies so that we can demand and receive healthier options. Our own health commissioner believes that this is necessary. How can we justify not taking her informed and educated opinion seriously when we elected her to the job just to be able to weigh in on these topics? I support this bill because the health of our community is important to me on a personal level. I support this bill because the future of our youth is monumental in its urgency. Health is a prerequisite to any thriving community, and healthier communities, students, employees, and relationships are good for our city. Our businesses and our livelihoods, they all will improve if we can improve our diet and the things that we are putting into our bodies. As our leaders and policymakers here at City Hall, we elected each of you to act on the behalf of and in the best interest of your constituents. This is literally the smallest step in the right direction that we could be making as far as progressive change in public health policy that we can take. If we can't depend on those that we have elected to do what's right, then it is our job as the people to replace people with those who will. Let's do what's necessary to give the people in this city the power to make healthy decisions and build wholesome lives and sustainable futures. And to the industry, I challenge it. I challenge this industry to stop spending money to fight us on our legislation and start to give funding to the parks like has already been done in Philadelphia and San Francisco. I challenge them to spend $1.2 billion on supplying internet access to all of our students so that they can be educated in these subjects for themselves instead of paying employees to show up to forums like this. At the end of the day, we have to look at our priorities, what we're prioritizing and why. And as long as capital and big business is prioritized over human livelihood and the importance of our children's futures, we have no future. Thank you.
Thank you, Mr. Mabin. Jim O'Hara from CSPI. Jim O'Hara, CSPI.
Good afternoon. Thank you very much for the opportunity to testify today. My name is Jim O'Hara. I'm the Director of Health Promotion Policy for the Center for Science and the Public Interest. We are a public policy reform group that has been focused on nutrition reforms in this country for more than 40 years. We have worked in Baltimore and in Maryland over the years with many local advocates. We stand strongly in support of the ordinance to require warning signs on advertisements for sugar drinks as well as on menus and at point of sale. In fact, in 2005, CSPI petitioned the Food and Drug Administration to require health warnings on sugar drinks at that time. We wrote, quote, "In light of the overwhelming evidence linking soft drinks to serious diseases, consumers deserve to know, and soft drink labels should disclose those health risks." That was based on the scientific evidence that had come to light during the development of the 2000 and 2005 dietary guidelines for Americans. Today, the science is even more established, as seen by the review of in the development of the dietary guidelines for Americans for 2015-2020. What that evidence tells us is that an extra soft drink a day increases a child's risk of becoming obese by 60%. Adults who drink one sugar drink or more a day are 27% more likely to be overweight or obese than non-drinkers. Soda consumption is associated with nearly twice the risk of dental caries in children and increases the likelihood of cavities in adults. Moreover, sugar drinks contribute substantially to the health disparities that disproportionately burden our communities of color and lower economic status. You have heard testimony earlier today about the San Francisco ordinance, and I think that that's an important point for your deliberations as well. In fact, the U.S. District Judge, Edward Chin, reviewed expert scientific testimony presented by both the soda industry and the city. And in his decision, he wrote that, in fact, the experts for the soda industry confirmed the science and that the warning was, quote, factual and accurate and in the interest of the public health and safety of the city. There has also been recently published research about the potential impact of soda warnings or sugar drink warnings on parents' decisions. And what that study showed was that it in fact gave parents the information that they needed to make more informed decisions and to be less likely to choose unhealthy beverage options for their children. Providing consumers with basic information about health risks associated with certain products is a tried and true public health intervention. It empowers consumers with the information they need to make an informed choice. Thank you very much for giving me this opportunity. In the testimony that we have given to the council, the judge's decision from San Francisco is an attachment, as well as the study that I referenced about how it affects parents' decisions. Thank you.
Thank you, Mr. O'Hara. Passing it back to Chairman Kern.
Thank you, Councilman. Where are we at on the list here? All right, David Burt, come on up. You are a parent, that's good to know, and a former diabetes drug developer. Okay.
Thank you, Mr. Chairman. I appreciate the opportunity to be here. So I'm from Baltimore. I left here to become a venture capitalist, an entrepreneur, and I spent a bunch of years in Boston developing a new drug for type 2 diabetes called Cyclocet that's on the market today. I got involved in that because my grandmother, who lived her whole life in Northwood, died from type 2 diabetes. Okay, so I have experience starting companies, raising lots of money, taking them public, and developing new drugs. One of my children recently, who has a predisposition to type 2 diabetes, who's 20, recently had to go into the hospital because her sugar had gotten out of control. And I spent the last 5 months getting her off of off of insulin shots with diet alone. And so I will tell you that the science...
How many units was she taking at the time?
Started at 24.
Okay.
And I was at the endocrinologist last week, and she's now off. But real quick, what I want to do is I want to give you kind of the entrepreneur's perspective here, and I want to give you 3 things I think other people aren't going to tell you. Number one, there was a study published by Tufts University recently that said that sugar SSBs kill 180,000 people a year. Do you know who funded that study? Does anybody know?
Sugar Energy?
The Bill and Melinda Gates Foundation. You know who's given billions to the Bill and Melinda Gates Foundation? Warren Buffett. He controls 10% of Coke. So two of the richest guys in the world, Buffett and Gates, paid for that study. Their study says SSBs kill 180,000 people a year. That's point one.
SSBs?
SSBs.
Not sugar in general?
No, SSBs.
Okay.
And I'm happy to provide it to you.
Okay.
Tufts, by the way, is probably one of the best nutrition schools in the world. Okay? Here's point number 2. I'd like you to look at, and I'm happy to give you the sites, the United Kingdom websites for Coke, Pepsi, and the UK Department of Health. Because the companies who were represented here by Ellen and by a friend of mine from Loyola High School, Kevin O'Keefe.
Are you from Loyola grad?
Yes, sir. Same time as Katie was graduating from Notre Dame Prep, and John Clark.
I was there a generation before you.
Yeah. So if you were, this is what I would ask, okay? What's wrong with Baltimore? because all these beverage companies have voluntarily agreed to unbelievably more restrictive things there in the UK and with the citizens of London than they are with us. So my question would be to them, look, we want to be partners with you. Why don't you treat us the same as you'll treat people in London? For example, as Councilwoman Clark asked, you know what? In the UK, Pepsi voluntarily agreed to stop, and they did stop, advertising any SSB at all in the entire country in 2005. Ask them, right? Why can't we have that here? They have a warning label on each can that points out with a red color that it's above the dietary limit. Okay, so whatever the macronutrient is. So for sugar, so if you look in their websites on the UK, Coke or Pepsi will show you that their cans are labeled in a way that's much more intrusive, in my opinion, than what you guys are asking for here, Dr. Wen is. So I think, one of the questions is just, why are we being treated less than London, right? Why are the citizens of Baltimore getting treated less well than the citizens of London? So that's point 2. Point 3 is, there's a World Health Organization study, a couple studies out recently, that the diabetes and obesity epidemics are the #1 public health problem in the world. It's the single biggest killer in terms of preventable diseases, okay? More people die from these epidemics than die in wars right now or terrorism. It's cost more, millions of citizens around the world are dying early, prematurely now because of this. It's huge in China, it's huge all over the world. It's more than $1 trillion a year. It's a worldwide problem. Baltimore has what I'll call, I'm into the NBA finals, we have like a whole team of Steph Currys, okay? So Hopkins is in the East. There are at least, I've been meeting with people there for the last couple of months about how to solve this. There are 1,000 people, the best researchers in the world are there. Okay, you have Maryland here in the center, and in the western part of the city, you have CMS, the Center for Medicare and Medicaid Services. So they're working on it too. They have 1,000 people working on this too, because as they will tell you, and as a lot of the financial people today will tell you, that the diabetes and obesity epidemics will bankrupt us. It will bankrupt CMS if we don't bend the curve. Okay. So what I would say to you, Chairman Curran, is this. I would adopt this now, and then what I would say is, look, we also have a Steph Curry of the health commissioners. So Dr. Wen, let's get all of these great people together, and here's how we're going to actually create a ton of jobs in Baltimore, is to create the solutions. They've made a ton of solutions to this that will solve this first in Baltimore, and then we can take it to other cities. Let me give you an example. There's about $2 billion a quarter being invested right now in venture capital by Bill Gates, Mark Zuckerberg, all these billionaires. They're putting their cash into different ways to solve this, okay? So one company recently in Silicon Valley called Juicero just launched. Zuckerberg and some other people put $150 million in it, okay? It's in part to solve this problem. So what I would say to you is, Baltimore has the most talent of any city. We're unique. Any city in the world to develop solutions, okay? So what I would say is, let's take Baltimore and turn it into the best city for health and for jobs for our citizens. Thank you.
Just a quick comment. You mentioned the WHO, the World Health Organization, and I take their, unfortunately, I take their recommendations or science a little bit with a grain of salt or a lot of salt, because when I was fighting the tobacco industry 10 years ago, they said that secondhand smoke does not cause a problem. So I take World Health Organization's.
Yeah.
Just a comment.
Yep.
All right. Before I go back to the opponents, I want to read into the record a letter we received from Congressman Elijah Cummings. I am writing to express my support for the sugar-sweetened beverage warning labels bill, which provides city residents with the information necessary to make healthy decisions for themselves and their families. 1 in 3 high school students in Baltimore is overweight, and 1 in 4 drink at least 1 soda a day. Research has proven that sugary drinks are the primary source of added sugar in children's diet. Warning labels would provide residents with needed information about sugary drinks' effect on the development of tooth decay, obesity, and diabetes. In troubling development, children now developing diseases previously seen only in adults, such as adult-onset diabetes and early heart disease. Studies attributed this change to children's diet, including an increase in the consumption of sugary drinks. We must act now to reverse these trends and prevent diseases before it starts. I believe that the sugar-sweetened beverage warning label legislation would provide meaningful information to the city residents for making healthy choices for themselves and their families. I urge you to give the bill every reasonable consideration, which we are doing here today, Congressman Cummings, and that's signed by Elijah Cummings, a member of Congress. We're now going to go back to the opponents, and Louise Johnson. Louise from the Maryland Beverage Association. Are you still here, Louise? All right, we're going to move on. She comes back. Maria Volcano. Maria, welcome.
Hi.
Okay, how are you today? Put the
Hi, good
microphone down,
afternoon.
Marie.
Thank you for letting me speak today. I'm Maria Vaccaro from Vaccaro's Italian Pastry Shop.
Okay.
I can't see what I wrote. I'm here to speak against the bill. My business is a business of sweets. We're a bakery, family-run company that we've just celebrated our 60 years in business. And I agree that too much of anything is a bad thing, but I think consumers are a little smarter than we're all giving them credit for. And I don't feel that a warning is going to change their mind about what they eat, drink, or do. Things keep just piling up on us as businesses in the city, and it's going to cost us money. I realize what you're saying. It's just a little small sign, and Baltimore City says they're picking up the tab for that. But are they going to reprint all of our sit-down menus, our carry-out menus, change our menu boards, all the other signs that we're going to need? It's going to be another cost to us. And I just don't see that this warning is a solution to what the situation is.
Okay. Now, you are from where now?
From Vaccaro's Italian Pastry Shop in Little Italy.
Okay. Okay. I've had the pleasure to be there. Maybe I'll get down there one day.
Pardon me?
Maybe I'll get down there one day. Good. Okay. Melvin Thompson, I know I saw you in the back. Welcome again to Baltimore City Council. No stranger here, Melvin. How are you?
Thank you very much, Mr. Chairman,
Thank
members
you.
of the committee. I'm Melvin Thompson. Other council members, I'm Melvin Thompson. I represent the Restaurant Association of Maryland, and we are opposed to this legislation very strongly. And I did submit my written testimony to council staff member
Yes, Mr.
Richard
Crumrick
Okay, good. He'll
will be
distribute
part
that
of it.
too. Okay,
Yes.
so you may not have it now, so I hope you'll allow me just to hit on a few points
Sure.
from my written testimony. Thank you very much. First, let me say that I want to give you the restaurant industry's perspective on this legislation and the reasons why we are opposed to it. This proposed mandate, which is unprecedented nationwide, would unjustifiably alarm customers about ingredients that have long been generally recognized as safe by the U.S. Food and Drug Administration. It is inappropriate for local government to require warnings that usurp federal regulatory authority. This would also put restaurant servers in a very difficult position of having to answer customer questions about these warnings on restaurant menus. You're absolutely right, Councilman Mosby. Obesity is a very complex problem that is influenced by many factors. Most importantly, a lack of exercise and physical activity, as technology has encouraged more sedentary lifestyles. And think about it. When was the last time you drove through or walked through your neighborhoods and saw children outside playing? You rarely see that anymore. They're inside, tied to their computers and their mobile devices. And parents allow this to happen. And it's not just children, we're all guilty of it too, all of us in this room. We need more physical activity. This proposed attempt, however, to scare people about products that are perfectly safe and can be enjoyed as part of a balanced lifestyle is not an appropriate approach to improving public health. Moreover, if this legislation passes, restaurants would be required to reprint menus, which is an added cost for these businesses. And these are businesses that are still struggling to overcome the declines in customer sales and customer traffic as a result of last year's unrest. And it's not just this. City restaurant owners are becoming increasingly frustrated by local public policy initiatives that make it more challenging to operate a business here. In addition to this proposal, in recent years, city food service businesses have also had to switch to more expensive and harder to source trans-fat-free food products, begin using more expensive paper bags for takeout purposes in order to avoid the hassle and fees associated with establishing a plastic bag recycling program, pay higher costs associated with the beverage container tax, pay new and very expensive fees to offer valet parking. And the pending $15 minimum wage proposal is yet another example of this piling on even higher operating costs. Many struggling businesses are now starting to question whether they can afford to keep doing business in Baltimore City. And it is for these reasons that we oppose this legislation and urge the council to reject it. Thank you very much.
Councilman Costello has a question, Mr. Thompson.
Yes, sir.
Mr. Thompson, do you live in Baltimore City?
No, I do not. I live in Anne Arundel County.
So to invoke the valet legislation and compare it to this is completely absurd. The valet situation in Baltimore City was completely out of control. Parking Authority and DOT have worked tirelessly with several of the valet operators, including those establishments which they serve across the city. And I think it's important to point out for the record that that has absolutely nothing to do with this. In fact, Parking Authority introduced legislation yesterday to correct issues in that bill, which this council passed to make it more business friendly. Thank you, Mr. Chair.
And thank you very much, Councilman. You're absolutely right. But what I was conveying to you was the concerns I heard from the business community about the piling on of all of these things and the compound effect of it all.
When valet parking is managed appropriately, it doesn't become a pile-on for local businesses. It becomes an amenity that relieves parking on the street for not only those businesses, but the residents that live here, as well as the patrons of those businesses.
Sure, and I understand that. My job is to communicate the concerns that were expressed to me by business owners, but thank you very much. I understand.
Quick question.
Yes, sir.
I know I'll see you next week on the other issue.
Absolutely.
If restaurants were amended out of this, similar to the way San Francisco does not do restaurants, would you guys be okay with it?
If we're not at all impacted by the bill,
Yeah.
I can't imagine that we would have a problem. I mean, I don't want to say that right now during the hearing because I would need to consult my members to see if there are any other concerns in general. We don't like to negotiate amendment language at a public hearing. We're only addressing the bill as it was introduced.
Okay.
But I'd be happy to take that back to them and ask for their feedback. Yes, sir.
Let me know.
Okay.
All right.
Thank you very much. Is that it?
That's it.
Thank you.
Scott Meskin from the Black Tie Vending.
Good afternoon.
You're not wearing a black tie today, but go ahead.
I wish I
Scott,
wore my
now
black tie today.
What industry do you represent?
Black Tie Vending Service. I'm also the president of the Maryland DC Vending Association and also a board member of the National Automatic Merchandising Association.
Thank you.
But primarily, I'm here today on behalf of Black Tie Services, which operates here in Baltimore.
Okay.
We have about 7,000 machines, 103 employees, and of course, we feel this bill would directly affect us in a negative way.
Would it affect employees?
It certainly could. I mean, if it could. If sales we project will suffer, consumers will be deterred from buying sugary drinks, which of course is a big part of our portfolio.
Do you also sell diet drinks too?
We do.
Water?
Juices.
Iced tea
which
that don't
have sugar, and iced teas that have sugar, and
iced teas that don't have sugar.
And iced teas that don't have sugar.
Okay. All right. Go ahead. I'm sorry, Scott.
In 2013, beverage companies launched the calorie count beverage vending program to make it easy for consumers to check the calorie of their beverages when making selections, and reminds them that the beverage calories matter. Calories count. Check the choose messages were placed on the front of vending machines, and vending machine buttons were updated to include calorie information for each choice. This legislation threatens to add costs to our operations and could result in job losses. The proposal not only would require warning labels, but threatens our members with penalties of up to $1,000. We have about 100 what we call our Goodness Inside program machine, which is a healthy vending machine. We were contracted through Baltimore City. We've got one in this building here. We've got one in the building across the street and all throughout Baltimore City.
Do you have any hospitals?
Many. We have Johns Hopkins Hospital. We have Kennedy Krieger Hospital. We have hospitals all through the state. This machine and this product selection was, of course, approved by Baltimore City as a healthy choice for vending. And now these warning labels would have to be placed on the front of these machines saying that the drinks inside could be dangerous to your health. Drinks like Naked Juice, where the only ingredient is fruit juice, or Izzy sparkling juices, for example, where it's just a sparkling juice. The last time I checked, and I know this is a lot about kids and children having access to sugary drinks, there's not a school in the country where you could buy a sugary drink. I mean, K through 12, it's just not available. It's against the law to be sold. So requiring warning labels on machines in this building, I don't see how that's going to deter children from buying drinks. I have 4 girls, 4 daughters. I don't think any of them have ever had a soda because my wife has never purchased soda in the house. They can't buy one in school. So when we go to a restaurant, my kids order water, always. It's just always the way it's been. I lost my train of thought. I apologize. So I think it's up to the parents to educate their kids. I think if parents are not buying sugary drinks at home, that will, of course, instill in their children water is the better choice, or maybe something else that has no sugar. But I think putting warning labels on vending machines, and I saw the size of that warning label, I have no idea how that would fit on the front of my vending machine. I have no idea how I'm going to monitor that those machines are not being peeled off, destroyed, and then I'm fined when the label is not there. Thank you.
All right, a quick question before I go to Councilman Mosey ask questions. You have the machines in this building.
Yes, sir.
And you don't have sugary drinks in these machines.
I do, sir.
You do have sugary drinks?
Yes, sir.
Do you have Coca-Cola?
Either Coke or Pepsi, or maybe both, yes.
Well, I haven't seen them, but maybe. So you haven't technically, well, you have machines in hospitals.
Yes, sir.
That don't have sugary drinks. Schools. You have schools. You have machines in schools.
K through 12, correct.
You have machines that do not have. So let's just take your machines in schools. Have you seen a appreciable decrease in the amount of revenue from those machines?
Yes, sir. A tremendous amount. About 80%. The only item we're allowed
Your
to sell.
machines are off 80%?
The only item I can sell in a school, K through 12, is water.
Water.
That is it.
Do you sell other products in your vending machines? Do you sell gum and?
I do.
Stuff like that? So, but sugar, you only have water.
In schools, I
Right.
can have very strict guidelines
Right.
on what I can sell. It has to be whole grain, and I don't know all the guidelines
Right.
off the top of my head, but when
Healthy stuff.
Healthy stuff has to be all healthy
Stuff
stuff.
I wouldn't eat.
Yes,
But you say your sales are off up to 80%.
correct.
Okay.
On the
Councilman
beverages
Mosey.
especially.
Councilman Mosey.
Not really a question. So I guess the thought process is with these warning labels, it's going to make someone less apt to be thirsty, and they're not going to choose anything, knowing that your machines have not only the sugary drinks, but also other healthier options. The consumer just decides not to make a purchase at all. Is that what you're testifying to us today?
So I'm going to use Johns Hopkins as an example. And you heard testimony earlier on the program they chose. Green, yellow, and red. So we put a green sticker on what they consider to be a healthy choice. a yellow sticker on the item that say is a lighter, you know, maybe it's not full sugar, maybe it's not sugar-free, and a red item on the full sugary items. I can have 2 selections out of 8 that have sugar in a standard stack vending machine. 50% of my sales are still coming from those sugary drinks, which is causing us to have to fill those machines more frequently than we normally would have to. So by putting warning labels on the machine and steering people away from sugar is certainly going to hurt sales. Sugar are going to hurt sales. So people that drink sugary drinks are not going to settle for a diet cola. It just doesn't have the taste that they're looking for. Some people would argue that, is that the healthier choice? Is a diet cola a healthier choice than a sugary cola?
How does Coke Zero, I should ask some of the experts, what is Coke Zero? Does that contain, what is Coke Zero? No sugar or no calories, what?
Neither. No sugar, no calories.
So Coke Zero.
It is an artificially flavored or sweetened beverage. Carbonated.
So it still has, you say artificially sweetened, it still has sugar.
It's either aspartame or NutraSweet.
Oh, okay, okay. All right. Thank you.
Thank you.
All right, Steve Boucher from the canteen, come on up.
Thank you, Mr. Chairman and council members. I'm Steve Boucher with Canteen Vending, and I'm also the Vice President of the Maryland Vending Association. We have 4 service centers here in the Maryland area supporting our customers, and we have an employment staff of 250 people. We have about 20,000 vending machines throughout the area that we service. City Council should really not move forward with this legislation because it's short-sighted and takes really the city in the wrong direction in regards to, you know, who we should be going after, a pretty large issue. Forcing us to carry misleading or inaccurate warning signs about popular beverages, such as, you know, lemonades, different types of teas, juices, fruit drinks, sport drinks, misses the opportunity to teach and lend the right message, which is really lifestyle choices. And those matter. So not necessarily new government bans or restrictions with warning labels for lemonade. They just don't. So products today are clearly labeled. You can look and see all kinds of nutritional facts on all the products that we provide. We provide a variety of products in all of our machines throughout all the vending channels that we have. You know, stickers, you know, Scott mentioned that they really won't fit on our machines, maybe across the middle where you can't see some of the products, but is not based on the ones that we have. We have, you know, different technology that's on there that people can look up nutritional facts. They can look at the products themselves and make an educated decision. Schools are regulated, as Scott mentioned, and really adults are educated and are at a mature point to where they can decide for themselves what is the right choice. We service large accounts like the health industry. If it's University of Baltimore, University of Maryland Medical Center, Mercy, you know, and then public areas like the MTA or even the city jails where you know, people have the choice, and we provide all avenues, all channels for them to select. So taking away a choice is really going to hurt our business. So, you know, in regards to, you know, we would have...
Before I ask Councilor Moser a comment, you mentioned taking away a choice will hurt your business, and gentlemen before you too, but wouldn't there be alternatives that people would go to?
Well, if you put up a warning sign, it's almost kind of saying, you know, don't come here, you know, toxic, or, you know, it's pushing people away.
Do you have any vending machines in rest areas?
We sure do.
So if folks pull over for a rest stop and they want to get go to the restroom and then get a beverage, and this was there, right? And you still had the product, sugary product in the machine. So as long as they see this, they're still either going to buy the sugary product, or they might buy a bottle of water. They might buy
There's enough information on the products themselves or in the machine that they can access to make those decisions.
Okay.
So there's no need to add that burden to business and provide that, really kind of scary sign to our patrons.
Scary? This is scary?
You see that on the side of a truck or you see that on front of our machine, I think it's scary, You got a color that's jumping out and say, hey, caution. And that's the way we're looking at it. So, we've done things in regards to the calorie counts being posted on the machines, and you can make a good decision from looking at the calories in these products.
So if you remove the warning there and just say that, would that be less scary? You don't have the warning, no warning to take that away.
We're against legislation being put on us as a burden to business.
Councilman Mosby.
But
warning, Councilman Mosby's coming up next.
that's fine. And adults, we believe adults can make the right decision for themselves without additional signage. And if the health department would like to have a campaign and do advertising within the city, then that may be a good approach as well.
Okay.
Thank you for your testimony. Again, this is not a restriction or a ban. I've probably said this, 10 times today. I just want to say that over and over again. No one is restricting, no one is banning, no one is telling adults what to do. This is just a warning label to make folks aware. Again, this is not an attack on any product. It's just talking about an ingredient, and that ingredient happens to be SSBs. So inside of that machine, there's going to be several different products, some with a lot of SSBs, others with limited SSBs or no SSBs. I think what this warning label will do is, you're right, those nutrition labels are on the sides of drinks. It's going to make folks more aware about reading those nutrition labels on the side of drinks. So, again, I'm hearing all these points about it's scary. I'm hearing all these points about, do you put the sign in the middle of the vending machine? I think that we're really going down a slippery slope of just trying to bring in things that have absolutely nothing to do when we're talking about just providing folks with additional opportunity to be more aware about their health and the choices that they're making in life. I'm not asking you, sir, to put this in the middle of your vending machine. I'm not asking you to restrict or ban this in your machine. We're just trying to put this out there so folks will be aware about it. Thank you.
Thank you.
All right, thank you. Comment? Councilman Scotsella.
I just wanted to thank you, Mr. Chairman. I have to leave for a community meeting. Hoping you'd excuse me. I got to be there at 4.
We're good. Michaeline Fetter, we're going to move on. We got about 8-9 people left to testify. And then I'm going to tell you the process after that. Hi, Michaeline, how are you today?
I am wonderful, and it's so good to see you after we fought the Clean Indoor Air Wars together many years ago. It's very hard to be original and say anything new after almost 3 hours of testimony, so I'm just going to skip around and give some observations. My name is Michaeline Fetter. I'm representing the American Heart Association. I'm a resident of Baltimore. The Heart Association is very, very much in favor of this legislation. I'm not going to bore you by repeating data, but some concepts I think we need to talk about. Childhood obesity is a national epidemic. I think we all agree to that. And if you look at specific data related to Baltimore City, the problem is worse in Baltimore City than in any other part of the state, and it's higher than national averages. Childhood obesity adversely affects minority populations, and data from the Heart Association, from CDC, from the Robert Wood Johnson Corporation, and many, many more reputable organizations do indicate that consumption of sugar-sweetened beverages is a major cause of obesity. And finally, an item that nobody really has talked about today. Each year, the United States spends an estimated $190 billion, with a B, dollars on obesity-related conditions. That represents 21% of all U.S. healthcare costs. So we have a motivating figure there. It's interesting the way you're calling some of the proponents, some of the opponents.
And try to be balanced.
Yeah, but I've been keeping score. And what is kind of interesting is that all of the proponents are concerned not for any kind of personal benefit, but because of their concern for human beings, for children, for the horrible effects of some of these diseases on children. When you hear about an 8-year-old child who weighs 200 pounds and is diabetic, that's something to be concerned about. and the opponents, everything they talk about seems to be financially related. So I think that's interesting, to keep that score. I would submit to you, and I know you say you like charts, and I have one for you afterwards. I would submit to you that the majority of people who purchase beverages containing added sugar really have no idea just how much sugar is actually in the beverages they drink. And the chart that I have for all of you is a chart that was developed, and I thank you to Center for Science and the Public Interest, but it shows the actual amount in teaspoons of beverages that people are drinking all the time without even realizing it. A standard small bottle of Coca-Cola has 15.5 teaspoons of sugar in it. A regular Sprite, standard small bottle, 15 teaspoons. Snapple, iced tea that people drink all the time, has 9 teaspoons. And this is even more dramatic when you actually see, which I've done, the teaspoons put into a container right next to the bottle. Lemonade, Minute Maid lemonade, 16 teaspoons. This is really serious, and people don't know. And the beauty of this legislation is that it does give people an opportunity to read a little bit about what they're getting into. And there are data, and somebody mentioned the study that the American Academy of Pediatrics did recently, which shows that point-of-purchase advertising is very helpful, and it will cause about 20% of the readers to change their selection. So it's a very, very, very important piece of legislation. We are totally supporting of it. This bill aims to educate. It's very nice to say let the parents teach them, but we don't let the parents teach them a whole lot of other things like math and arithmetic and science and so forth. Not every kid has a parent who knows what to teach. So we've got to rely on some external forces, and I think this bill is a very good step towards eliminating or reducing at this point part of the
Hi, Magdalene.
obesity problem. Thank
you. From the Heart Association, Richara Jones from CQ. All right, we have Carol Hozan from Healthy Foods America. Carol? Oh, there you are, right in front of me there. How are you?
Hi,
Thanks for waiting to testify.
I'm well, thank you. My name is Carol Hazen.
Hazen, all right.
No, I like that, though. I get that sometimes. That's
Okay.
a nice pronunciation. Thank you. I'm here on behalf of Dr. James Krieger, the Executive Director of Healthy Food America and
I
Clinical...
thought he was going to appear today.
I'm sorry?
I thought Dr. Krieger was coming today.
Oh, I'm Dr. Krieger. Do you don't recognize me? No, he
All
said
right.
he was unable to make it, so
All
I'm
right.
here with his statement, if
Okay,
that's okay.
sure, that's fine.
Okay, thank you. So Dr. James Krieger, Executive Director of Healthy Food America and Clinical Professor at the University of Washington Schools of Public Health and Medicine. He was invited to provide testimony and regrets that he's unable to be here in person. So from Dr. Krieger. For
Okay.
25 years, I worked in the Public Hospital of Seattle, where nearly all of my patients had chronic diseases like diabetes or heart disease. In most cases, unhealthy diets caused and worsened their conditions. I recall one patient who was struggling to manage type 2 diabetes. He was confident he had a healthy diet, but he was drinking a gallon of fruit punch a day. Because it was marketed as a healthy fruit-based drink, he thought he was making a healthy choice. Once he became aware of how much sugar it contained, he cut it out and his diabetes control improved dramatically. After years repeating conversations about the dangers of products with excessive amounts of added sugar, I realized that I was no match for the industry's marketing to open happiness and live for now. To make a real difference, I needed to promote healthy food policies. So I started a national nonprofit called Healthy Food America to act on the growing scientific evidence of the harmful health effects of added sugar. I became convinced that I needed to promote high-impact policies that drive down added sugar consumption. Here is what convinced me. People drink too many sugary drinks. Half of adults and 2/3 of teens drink them daily, leading to an average per capita consumption of 40 gallons per person per year. In Baltimore, 4 youth drink 1 or more cans of soda per day. And these drinks are dangerous. Consuming sugary drinks contributes to weight gain and obesity, diabetes, heart attacks, and dental caries in children. Yet many people are unaware of the health risks of sugary drink consumption. Research shows that many parents, especially from low-income and minority communities, believe fruit drinks are a healthy alternative to soda for their children, yet they are just as bad. These are the same communities targeted by misleading industry advertising. Sports drinks, also no different than soda, are perceived as promoting hydration and health. This lack of knowledge is not surprising. Beverage companies spend $1 billion a year to market sugary drinks, particularly to children, youth, and communities of color, and it works all too well. The onslaught of industry advertising must be balanced with accurate information about the health effects of sugary drinks from trusted sources so consumers can make informed choices. Placing warning labels on sugary drink ads is one important and highly visible way to do so. Warnings would help Baltimore parents protect their kids. A recent study found that parents who read a warning label were significantly less likely to choose a sugary drink for their kids. If Baltimore were to adopt a warning label policy, it would join a growing trend to provide consumers with the information they need to make healthy choices. Just last month, the U.S. Food and Drug Administration acted to require listing of added sugars on the Nutrition Facts panel. San Francisco adopted a warning label ordinance in 2015, and just last month, a federal judge dismissed an industry suit to block implementation, saying the city has a legitimate interest in public health and safety, and the warning that sugar-sweetened beverages contribute to obesity and diabetes is reasonably related to the city's interest in public health and safety. Had my patient with diabetes had the benefit of seeing a warning label on the fruit drink he consumed every day, he would have been alerted that the product he thought was healthy actually contained enough added sugar to harm his health. Warning labels have the potential to improve health in Baltimore, and I applaud the council for considering this important health issue. Dr. James Krieger, Executive Director, Healthy Food America.
Can we have a copy of that for?
Yes, by all means.
Okay.
Thank you.
All right. All right, thank you. Thank you very much. Carol, thank you. Willie Foster, Healthy Ways. Willie, thank you. Thanks for waiting today.
I'm good, thank you. Good afternoon, members of the City Council and guests. My name is Nurse Will Foster. My function as a nurse is as a care coordinator, primarily for the senior population of Baltimore.
Senior population?
Yes, sir.
Okay.
I am tasked with educating my members about proper health maintenance and making better choices regarding diet and exercise, amongst other objectives, such as reducing emergency room visits and hospital admissions. Currently, there are several epidemics in the city of Baltimore. Some include gun violence, drug abuse, and the consumption of sodas and other sugared sweetened drinks. The first two issues will be discussed at another time, but I'm here today in hopes to convince you that the latter can be taken off the list of city epidemics if the council will move forward and pass the bill to place warning labels in businesses about sugar-sweetened drinks that warn that overconsumption of these items can lead to diseases such as obesity, diabetes, kidney disease, heart disease, and cancer. As a city, we are fortunate to have one of the foremost leaders in public health research in the country in the Johns Hopkins School of Public Health. We have been warned for several years about the crisis of overconsumption of sugar-sweetened drinks and sodas, but it has continuously been ignored. Sarah Bleich, an associate professor at Johns Hopkins School of Public Health, discussed in an article entitled "The Exercise Cost of Soda and Juice, 2011, that the perceived notion is that most people only glance at labels for a few seconds, so simplicity is apropos, and the people who consume the most junk calories are also those with the least education and health literacy. These are the populations with the highest rates of obesity and related chronic diseases. These labels need to reach and speak to, most importantly, those at-risk groups. Quoting from her article, Professor Bleich launched her initial 2011 foray into exercise labeling investigation after driving around some of Baltimore's low-income neighborhoods. She saw boarded-up houses and drug trades on the corners. Professor Bleich thought, do people who live here care about the calories in the food that they eat and drink? The professor posted the exercise equivalent signs in one corner store to good effect. the people did care about the calories they consumed. With these results, the professor explored a larger, more substantial version of that original study, including the subtleties of changes in people's decisions. The research looked exclusively at African American middle school and high school students in urban Baltimore. According to the American Health Association, on average, African American adolescents drink twice as much soda and juice as guidelines recommend at maximum. By leading kids away from soda, Professor Bleich was convinced that the labeling system is a prudent approach. Of the kids in the study who said they saw the signs, 40% said they subsequently changed their behavior. What this article shows is that if we inform and educate the population most at risk, they can and will make better decisions. Other research articles discuss how a certain ingredient in caramel-colored soft drinks have a direct link to increased risk of developing cancer. As a healthcare provider, what I've seen is an increase in morbid obesity and other adult onset diseases in our youth, as well as an increase in the aforementioned diseases in the adult population. In my lifetime, I witnessed a very good friend of mine's mother consume about a 6-pack a day of Coca-Cola for over 2 decades. She died of cancer. The City Council has the opportunity and obligation to help end this epidemic with the addition of warning labels on sugar-sweetened drinks and sodas. In doing so, you will help save lives, reduce emergency room visits and hospital admissions, and reduce healthcare costs incurred by healthcare facilities and insurance companies. Let's show the city, the state, the country, and the world that Baltimore can be a proactive leader for important medical and social issues and not just a reactive government to the many woes that gloom our beautiful city.
Thank you. And you've mentioned the healthy ways, and give me a definition of that group.
Okay, I work for HealthWays, and they are contracted by CareFirst,
Okay.
the insurance company. With the particular group I work with, we work with Medicare patients, but they also work with regular adult population as well as pediatrics.
Okay.
And making changes to people. We found that if we actually contact people on a weekly basis and discuss and teach them about the choices that they're making, because that's the biggest problem that's going on. And I speak to many of my patients about the word ignorance. It's been turned into a bad word when it simply means you don't know. You have all of this information on labels, but the problem is many people do not know how to read the labels. So what I'm educating them on is how you properly read a label. You go down, you see the calories, you see the sodium content, so forth and so on, but then you need to come back up and look at the serving size. Because
Right,
that's what
how
many
many
people make
servings per-
right,
per,
the item that you're consuming. It could be 1 can is equivalent to what you have on there, or it may be half this can. So if you drink the whole can, you're doubling everything.
Okay. I look at the warning labels all the time. I don't focus on sugars. I focus on fiber. But I appreciate the warning labels and, or at least the nutritional value labels on these products.
Well, to also address, you mentioned about, is it okay to drink that Diet Coke? Technically, no, it's not. It's still poison in the can because they found that there are carcinogens in the caramel-colored sodas that can lead to cancer.
Well, basically, Coca-Cola is caramel-flavored sugar water.
Pretty much.
All right, well, thank you.
Okay, thank you.
Ronnie Rawl from Sugar Free Kids. Yeah, I'm sorry you're waiting to the end here, but thanks for staying.
Happy to be here.
Thank you, Ronnie. Now, what is Sugar Free Kids?
All right, well,
Use the microphone down.
Yeah, you got it? Okay, so I'm Robbie Rawl with Sugar Free Kids Maryland. We are a diverse coalition representing 130 organizations that are based or working in Baltimore City. So we're the city and the state's foremost advocate for protecting children in Maryland from type 2 diabetes, heart disease, tooth decay, so they can live long, healthy lives. Pretty basic. And we're focused on sugary drinks because there's an overwhelming body of evidence that shows that that's the primary cause of these major problems. Usually, the American Beverage Association is opposed to measures we introduce. And you've heard a lot from them today. Clearly, they don't seem too happy about this measure. But I've got to say, I'm so relieved that we can be on the same page with this issue because this bill is about education, right? It's about transparency, and it's about a consumer's right to know all the facts, to be able to make informed decisions for themselves, whether or not to purchase and buy a sugary drink. So fortunately for all of us today, the Beverage Association stands behind education. So let me quote from their own materials. This is a handout given to us last Tuesday. So we had a social justice forum up on North Chester Street by Ellen Valentino, who you heard from earlier, the executive vice president of the American Beverage Association. So the whole, pretty simple, nice and clear, easy to read. It highlights the myths versus the facts of this situation as the beverage industry sees them. So let me highlight their final point. It says, fact, if we want to get serious about obesity, it starts with education, not laws and regulation. So you can find the same thing on the webpage that they reference. You could Google it right now, called letsclearitup.org. Okay, the link is also in my written testimony, so you can check it out. And repeatedly, the Beverage Association, the Restaurant Association, and other interests push education as the solution to major health crises. Trust me, we know we're always meeting them in places like this. They say education does the trick. People are smart. Let people decide for themselves. And so we're here today discussing just that. Education, informed choice, transparency, right? Let the consumer decide. Honestly, it's refreshing to be able to share something with them, right? So a few years ago, PepsiCo, at the time, also represented by Ellen, was part of the task force on childhood obesity convened by the Baltimore City Council. Councilwoman Agnes Welch, the mother of our very own Councilman Welch, led the charge. This in-depth report, of which they were a part, cites educational measures as one of the ways that this city must combat childhood obesity. So it's here. I imagine that was a long process to put this together. There were a lot of opinions involved, very well vetted. So far, however, people who live and work in Baltimore City, it seems like this wasn't followed through with so much. People in Baltimore City have only heard one side of the story about sugary drinks. We hear claims that sports drinks are good for our health, that we will be younger, more vibrant, and more fun if we choose sugary drinks. Open happiness, have a Coca-Cola, live for today, right? Drink a Pepsi. It's sweet and innocent, like roly-poly polar bears, or desirable, like Beyonce. Okay? Millions of dollars are spent pushing this message to children and to low-income communities. There's plenty of both here in Baltimore. And the nutrition label that is already there, we heard it lists sugar, but it doesn't make that next step to what all that sugar does to you, right? So when you turn around that Coke Classic and you see it in the vending machine, and you can see that a Coke Classic, that 20-ounce bottle, has 65 grams of sugar. Right now, you need to know a whole lot about nutrition or medicine to know what that means.
How many grams of sugar?
65 grams, that's 17 teaspoons.
In a 20-ounce?
Yeah. You put 17 teaspoons in your coffee, I mean,
Oh,
you probably couldn't finish it.
You say how many teaspoons?
So in a 20-ounce soda, which is what you get in a vending machine
Right.
typically, it's 17 teaspoons.
Oh, I
with
see.
65 grams.
I see the microwave provided is 15 and a half, but that's 16 ounce versus
Sure.
20. Okay.
Sure, but without a medical background, we don't know what that next step, what does that mean? And the warning label clarifies that, right? We don't hear what these drinks actually do to us, but the scientific evidence is there, and the warning label makes it clear. That amount of sugar contributes to heart disease, diabetes, obesity, tooth decay. That puts it in plain English, right? I mean, that's what we need. You shouldn't have to have a degree to be able to buy, make an educated choice. And you've heard from many people today why that's an issue. So for the average person, the regular thirsty person who doesn't have a degree in medicine or nutrition, we have no idea how harmful these drinks are when used as directed. So we have no idea that drinking them on a regular basis is going to hurt us and our children in that way. So this bill is about Awareness. Simply put, education, transparency. Okay? We all have a right to know. You know, I'm a Baltimore City resident. I have 2 kids. This is personal also. And with a quick glance, you know, my son, once he learns how to read, he'll be able to read it for himself, you know, and for the rest of us. With a quick glance, we'll be able to see, you know, and make a decision for ourselves at every purchase. And the beverage industry has long stated the importance of such educational measures. Thank you for your support.
Thank you. Any questions, Kendall? Thank you. Richard Bruno from MedChi. And that finishes that page. We got one more page to go, guys, so we're working through it.
Thanks for your patience, Chairman. I'm Richard
Doctor.
Bruno. Yes, sir.
Okay, you
Resident
come prepared.
physician.
You must be come right from work.
Took the afternoon off to be here for this very important
you.
occasion. I'm a resident physician in family medicine and preventive medicine.
At where?
Johns Hopkins and MedStar Franklin Square.
Okay. I use Union Memorial.
What's that?
I use Union Memorial.
Oh, okay, yep, in the MedStar family. Yes, sir. I'm also a member of the Board of Trustees of MedChi, the Maryland State Medical Society, and I'm also on the Board of Directors of Sugar Free Kids Maryland. I have 2 young children at home, and I see hundreds of Baltimore children in my clinic every year. And at each and every visit, I encourage parents to limit sugary drinks, because that's what the latest evidence-based medicine suggests. They're dangerous products, and they cause significant health problems. A warning label would help physicians like me to spread this message to the citizens of Baltimore. What Councilman Mosby and the City Health Commissioner, Dr. Lena Wynn, are suggesting here today is that educating people in Baltimore that these products are dangerous to our community and that we can help people make an informed choice when they purchase beverages. Because just like cigarettes, sugary drinks have 0 health benefit. They have 0 community health benefit, and they have 0 public health benefit. In fact, they harm people. Researchers estimate that 184,000 preventable worldwide deaths each year are associated with sugary drink consumption. People die of complications from earlier heart disease, diabetes, and obesity. And this is taking a toll on the people of Baltimore as well, where 1 out of every 6 children in Baltimore is obese. We want to warn people that the products are dangerous, but not everyone believes the data. When you hear multinational companies talk about personal responsibility, how it's not our fault that people buy our dangerous products, I want to say to you now, we need some corporate responsibility from the companies and the businesses in the area selling dangerous products to commit to a healthier Baltimore. They need to be accountable to our community. This legislation will not take away people's choice, but it will inform their choice so that they can choose how much they want to indulge. Last week, on the day before her 64th birthday, my patient passed away from a heart attack at home. She had dropped off her teenage son that morning, and he came home to find her dead. I cannot begin to imagine the horror that he felt and will continue to feel for the rest of his life, losing his mother at such a young age. Over the weekend, I retraced my office visits with her. Over the past 3 years, she's obese. She has heart disease.
Was she a smoker?
What's that?
Was she a smoker?
She wasn't a smoker.
Was?
No,
Oh,
sir.
okay.
But she had been on all the best medications to help prevent cardiac problems. We talked repeatedly about her soda consumption. I asked her why drinking less soda would be good for her. And she told me that she wanted to see her son graduate from high school. Now she'll never get that chance. So I call on you now, esteemed council people, council members. You were elected by the citizens of Baltimore to represent the interest of the people of Baltimore, not the corporate interests who are beholden to their stockholders. Please join me in the fight to improve the health of all the people in Baltimore by warning people of the dangers of consuming sugar-sweetened beverages. Thank you so much.
Doctor, obviously your patient had a sugar issue. Did she monitor her sugar, finger prick?
Yes, we monitored all of her blood levels very closely. She did not have diabetes, but
She
she
did
did have
not?
heart. She did not, but she did have heart disease.
Right.
And knowing that drinking sugar-sweetened beverages contributes to heart disease, in addition to all the medication issues that we had done, the walking around the neighborhood, the exercise, her soda consumption likely had a contributing factor to her death.
Contributed, but wasn't a primary factor, obviously. It might have been
Well, when I filled out her death certificate, you know, I don't list sugar consumption on the contributing factors, but I know, especially from the research that has been given over the last few years, as you've heard, hundreds of
She didn't
papers.
take any medications for diabetes?
No, sir, she did not have diabetes, but she was
I-
obese and she did
I
have
take
heart
5
disease.
medications a day for diabetes. So I'm aware. Thank you, doctor.
Thank you.
For taking your time. Your testimony you want to submit. Jamal Day? Jamal, you here? I know we're getting down to the end here. Some of these folks might have left. Gene Berman, Maryland Association of Manufacturers. Gene, thank you for waiting. You must have arrived late because we had 4 sign-in sheets before you.
Actually, Mr. Chairman, I got here at 12:30.
You got here at 12:30?
I did, yes. And I just
Well,
realized
you're on
I-
page number 4, and there was 4 pages, much 3 pages in
Well,
front of you.
yeah.
That's all right. But thanks for waiting. Let's see what you got to say.
Thank you very much.
Yes.
And I do understand that I might be standing in the way of your adjournment, so I'm going to do this very quickly. It's Gene Berner representing the Manufacturers Alliance of Maryland. And, you know, one of the things that strike me after having the chance to listen to this for almost 3 hours, and you said it, Mr. Chairman, you said, I'm going to take the proponents and then some
I
opponents.
try to do that, try to blend it.
You said balance.
Right.
That's the key word, and I think that's the key word from today's hearing. So since I'm kind of batting mop up here, it strikes me that to do the balance, you got to avoid the tipping point. You know, and God only knows what that is, and it's something different in every instance. But there are kind of 3 things that struck me as I was listening to both sides, and both sides make great arguments. One of which is chipping away, and you are, through this legislation, attempting to chip away at a health problem. But the other side said piling on. And so how do you rectify the difference between the chipping away at a serious health problem and the piling on that the businesses feel that's happening to them? And you can't ignore either one, but you need to come to a place where it's acceptable both ways. That balance you mentioned, Mr. Chairman. The other one was not mentioned yet, but mandating versus finding another way to accomplish the same thing without mandating. And that's something that you all are faced with all the time. And I think that what I would encourage you, in fact, on this bill, because we are opposed to the bill as it is, but I would encourage you to see if you can find another way. And maybe there is another way. I'm not smart enough to know what that is, but you all are, and I would really strongly encourage that. And finally, yeah, it's a health issue, but it's also a business climate issue. And that's a little bit like the piling on thing, where sure, it's a serious health problem, obesity, whatever, but also so is Baltimore City's business climate. And I know that you all want to do everything you can to help improve that business climate, to help for grocery stores and food deserts and the like. So I just encourage you in your deliberations to remember that that balance is so critical on both sides. And in this instance, I think this could be a tipping point on the business climate side. With that, thank you very much.
You represent manufacturers.
Yeah, it's a coalition of manufacturers throughout Maryland.
Do you represent our friends, my former employer, down on Key Highway?
Oh, Domino?
Yeah.
Yeah, not at the moment, but I did a while back, and then they had a change in venue and things. But, you know, companies like, and I'm not speaking on their behalf, these other companies, because they're not affected by this legislation, but a McCormick, for example, or WL Gore up on the Eastern Shore, those quality manufacturers.
Okay.
Okay? Thank you very
Gene.
much.
I'm going to butcher this name, I'm sorry. Sumageska from the NFK of Maryland. Semeska. Okay. Rebecca Woods already had her testimony in. Jacina Wise. Jacina. Kara Shipley. You already did? Okay. Akil, and I can't understand. Well, how do you pronounce that last name? Patterson? There is no way that's Patterson.
It is. I'm just a...
Thank you, Akil. Go ahead.
So, gentlemen, I will say that I did not prepare written testimony because initially I was not going to testify. But I was encouraged to by my friends.
Just let you know, you are the last one.
Oh, wonderful. I'm not only my name is Akil
We saved
Patterson.
the best for last. Go ahead.
And I'm not only a Baltimore City resident, community advocate. I do work for I do work for Sugar Free Kids. I'm also on the DNC's LGBT caucus. I serve on many boards and many things related, including the HIV non-discrimination and several other boards across this nation. I am a public health advocate across the country. And I do work with legislators, not only here in Maryland, but across this nation to get things done. And one of the things, the first thing that I've always done is I said, what can we do to work with the other side? Consistently, I've worked with opposition in different states to try to find out middle grounds, from Indiana's RFRA repeal to Georgia's non-discrimination clause laws. I've always worked with the other side to find the middle ground. This is the first time in my life where the middle ground hasn't been decided because the other side refuses to sit down with us. When we sit down and we say, hey, what can we do to make this a fair and equitable bill? It was said to me at one meeting, we're not going to write the legislation for you. When we sat down across from the aisle and we showed a movie, they said, well, you're relating things to gun violence. Absolutely, there are things that are related to gun violence because any injustice in this country is an injustice for all people. Baltimore City is a very small city with a very large target on it. Health disparities, crime, pollution, diabetes rates, murders. We see them all. And they're very transparent because we are a small, big city. It is time to sit down at the table, all of us, and find out what works. We can't legislate our way out of a health disparity. We know this. But we must make small, incremental steps to make sure we pass something that helps people get educated on a daily basis. So mothers and fathers and children who do not live in the ivory tower that I now sit in sometimes have access to those things. We have 68% African Americans in this city. We have 83% African Americans in our school. And of those, we know almost 46% of them go home to impoverished homes every night. With no internet access, so they can not be in time to, oh, well, you just go on our website and you guys can get educated there. Well, if they don't have internet access, how do they get access to your education? And then they say, well, you guys can just educate them at summer in youth programs. Did anybody else not see that our youth programs during the summer are not fully funded and that we're fighting for that funding daily? So when you say we can, of course we could if we had the funding to do it. Trust me, I go out to these schools every week. I am in my community every day trying to make change. But I am one man trying to educate 380,000. 667,000 in this city. So if a few organizations are tasked with doing that work and they can't get the funding and the resources to do it, what is another way we can get it done? We come and we ask our legislators to simply say, hey, can we get a warning label? Massive, massive education. Small bandwidth. We can do it. But then our proponents say, well, it's going to impact us. Well, I tell you what, folks, it's already impacting us. It's already impacting our youth, our families. In the 7th and 9th district, we know that they have less life expectancy than any other place else in the city. But here in the 11th, where most of the companies and industries and corporations and businesses are, the life expectancy is a little higher. We know that education is directly related to this. So for those of us who had the blessings to go to college, to go to a quality high school, to get an education, and to understand how to read some of these warning labels, it was great. But then, for those that didn't get to finish school because they couldn't go to school because there was a shooting on the corner the next week, or for those young men and women who just didn't have that opportunity to go on to college because their families couldn't afford it, because every opportunity was stripped. This is the reality. This is not going to be fair to everyone. But if it is fair to the masses, then we can live with it. And this is a small ask, educate the masses to save millions and possibly billions of dollars in healthcare costs moving forward. Because you know what? The same kid that has to get his foot amputated because he has type 2 diabetes and he couldn't get medical access and he couldn't get informed when he was 13, we're now going to be paying for him for the rest of his life. And that will cost more than just one business. I thank you all for allowing me to speak for a few moments.
Thank you. Thank you.
Any
We're waiting for
questions?
the end here.
Thank you.
I believe that's everyone that's signed in to testify. Did you have a? Okay, I'll give you a minute or two. Sure. Yeah. Say your name for the.
Sure. My name is Eric Detius. I am a employee of Coca-Cola Consolidated.
All right. Spell that last name so we can.
Sure. Let's say it again.
Spell your last name.
Oh, good one. Dietzius.
Okay, Tedious. Okay.
I've listened, I've been here since the beginning, and I've listened to a lot of arguments for and against, and I'll tell you what, both sides have a lot of really good points. There is a large consumption of sugar amongst culture, and it is bad. What's bad about it is that they're over-consuming it. What's bad about it is that they're not doing other things to balance out the calories and the sugars that are coming in. Okay. What's bad about it also is that they're kind of, sitting around playing video games or something like that and watching TV or just sitting around. All right. One of the biggest issues that hasn't been touched here is that if you go through the city, I'm not a city resident, so I can be corrected here, but if you go through the city, I don't know of any large grocery store that is selling the healthier options, not just of the drinks, but of the foods, the natural foods, things.
Well, a lot of the stores have an organic section. Or,
That's
organic
probably
aisle.
true. But now the other component to that is what we also need to really focus on, and I've been kind of an advocate for this, is these organic foods and the natural foods, they cost way higher than the processed foods, the things that have all the junk in there that we can't even pronounce. So the other thing that I noticed is that there was a lot of seemingly villainization of the industry, and there was the kind of subtle innuendos of comparing sugar beverages to heroin and drugs and cigarettes and tobacco. It puts that subtle thought into the mind. Okay, and one thing that no one really realizes, and there was a tall gentleman that spoke as a proponent of the bill that said, why don't the beverage companies start focusing, stop focusing on their profits and start focusing on building parks and things like that. Coca-Cola has been doing that I've worked for them for 14 years. They've been doing it way longer than that. Coca-Cola is a huge component of a healthy, balanced lifestyle. And they do a vast amount of funding throughout the country, throughout the world, to build up parks. Yeah, and here in Baltimore, I have good news, actually. I have good news for you, because Coca-Cola Consolidated is even better at funding initiatives and providing funds for healthier parks and things like that. And I can tell you right here that we are focused on the city. We are focused on the city. So there is a lot of good that these corporations do, and I think that really needed to be touched on. Two people mentioned that the African communities are hit harder, but it's mainly because the kids are scared to go outside. No one's playing. No one goes out to play because either their parents aren't letting them, or like you mentioned, that there was a shooting on the corner last week. So who's going to go outside and play? No, I mean, I wouldn't let my kids out if something like that happened, down the block or something like that. I wouldn't let my kids out to play either. So what needs to happen is that a focus needs to be put on providing better recreation centers, safer recreation centers, more options, many more options for athletics. And I think that would be a humongous step. And it's something that all these corporations that we heard from today would gladly join up in.
Now you represent Coca-Cola
Well, I work for them, yeah.
on Crescent
Speaking-
Street? Down on Crescent Street?
No, I'm over in Hanover, the sales center.
Oh, okay.
hmm Part of my territory is here in Baltimore City.
Thank you. Thank
So,
you, Mr.
and just one more thing.
Sure.
On a personal note, I have made a transition. Now, I personally cannot really consume sugar, just or added sugars and preservatives and things like that. I personally can't do it. There are other people that can, and to just say, well, we're imposing this on everyone, it's kind of a little bit nearsighted, I think. So,
Thank you for your. Thank you for being here today.
thank you.
For 3.5 hours.
I know. Thank you very much.
All right. The sponsor had to have a comment, and I'm going to comment for a minute, and I'm going to tell you what's going to be our next step here. To those who are here that want to hear, obviously we don't have a quorum of the committee to vote this afternoon. We may not have a quorum of the committee that is in favor of this, but there could be a quorum of the committee that would move this with no recommendation to the floor of the council. But before that even is anticipated, we will have at least one work session to go over several amendments that were asked about today. The law department has amendments that work with the health department. Some of the sugar industry folks have amendments in the definition of what sugar is. So, and other amendments which we may anticipate reviewing with the committee in a work session. Obviously, that will not happen today. But I want to tell the sponsor that we will have a work session, and then we will try to amend this bill in some fashion to be as palatable to all. Obviously, I know that, and obviously I'm in a peculiar situation. Worked 16 years with Domino's Sugar, but I'm also a diabetic. I'm also take 5 medications a day, and suffer problems that diabetes has caused me directly because of sugar intake all the years. Not because I worked at a sugar house, but my diet is not the healthiest. And folks notice that I've lost some weight over the last year or so. I actually lost about 20 or 30 pounds because of diabetes affecting my weight loss, because it affects the kidney, which affects muscle loss. So I'm actually not losing weight, I'm losing muscle. So I have issues with diabetes. I also sponsored a resolution about 10, 12 years ago on diabetes when Dr. Sharpstein was here concerning how it affects our general population. So I worked both sides of the aisle. I worked in the sugar industry, and now I'm a diabetic.
That's why he's going to be supportive.
That's why we're going to have a work session, and we're going to try to get this bill to the council as a whole, and let the council as a whole make a decision. I will tell you that we will try to get it to the floor if there's enough votes in the committee with no recommendation. But we need to work over the amendments, and that's going to take another work session. Just let the folks know, when council committee has a work session, it doesn't really take public testimony, but it works among themselves, and some council members may ask for some the expertise from the industry and/or the proponents of this for comments there, but it won't be a public session where people sign up and talk. It'll basically be a work session of the council. So that being said, I will tell the sponsor we will announce a date that he will be available for Monday. I will announce a date in July when we can do work sessions. Even though we don't have a quorum here today, the bill is not dead. It will be reviewed in a work session to try to amend it, and we will try to get the will of the entire council by getting it to the floor. I just let the council president, staff know that, and let the administration folks know that also, that this is and affects a lot of our population, and diabetes is directly related to the amount of sugar intake. Whether we learn that, it's a problem, then maybe we all need to know that. So the warning label is not doesn't forbid sale of sugary sweetened beverages. I do know, and I know the councilman from council sponsor doesn't want to hear about putting some sort of tariff on sugar sweetened beverages like other cities are, but that does reduce the intake of sugar sweetened beverages. Whether the warning label has the same effect, that remains to be seen, Councilman. But and I know that that's going to be a situation where we're not going to be in a vacuum where we just do the revenue generated on sugar sweetened beverages versus the other counties. So I know that's not going to fly. But that is one way to reduce sugar sweetened beverages. But with that being said, no comments from the sponsor? I want to thank you for being here for the entire duration.
It's my bill. I got to be here. I wanted to thank everybody who remained for coming out. This is a critical issue. How we can't always be on the same sides. I think that it's always good to have thoughtful discussion. I think that that's exactly what we had today. I look forward to the working session. I would like to thank you, Mr. Chair, for holding a very efficient and informative hearing. Again, I look forward to the work session. I ultimately look forward to passage of this bill come this term. Thank you.
Just a final comment. I know we had an issue about 10, 12 years ago with then Council President Stephanie Rawlins-Blake concerning notification of posting of signs in pregnancy centers, saying that there are other options for folks that are with child, I guess it can be delegate here. And that was much to do about nothing. There was a lot of uproar. Oh my God, you're gonna make this sign saying we got options, other options for pregnancy, and it was a little bit of sign about the size of this. And I've visited several pregnancy centers sponsored by Catholic Charities and others that wanted to have their folks go through the whole term of their pregnancy versus other options. And the sign was the size of that distance, and they made much to do about that sign. And I go in these pregnancy centers, they got about 300 signs around there for everything else. So I don't think this is much to do, as folks are saying it is. And if it helps in the long run with folks being educated, this might be an option. So I'm inclined to have the work sessions and see if we can get the council committee members to agree to move it somehow in some fashion. And I'll make that statement public, because I waited to the day, I kept sort of neutral to the day till I heard both sides. And obviously, I'm sensitive to the business folks in this city, and all of us are. It's tough to be a businessman in this town. Will a 4x11 sign saying, consider what you're buying, is that going to be a detriment to business? Wow, it's a stretch. But with that, I'm going to say adjourns at this time the Health Committee of the Baltimore City Council.
Thank you, sir. Good.